wellness. My health and your health. What better way than after hearing the word in the morning, we can congregate here this afternoon and just listen to what God tells us, that we need to take care of this body because it's God's vessel, isn't it? Pastor Kathy, isn't that what the Bible says? That this vessel is God's body, so we need to take care of it. So I want to tell each one of you who is here today that this is a beautiful, beautiful afternoon because women's health, women's wellness matters. And we are talking about every woman, but today we are addressing ourselves to the women here. I hope that by the end of this afternoon, the message we shall hear clearly from the great speakers that are here today is that you and I need to take care of our health and our wellness. As you may know, and I think Anne Veronica has just stated it, I started this brand called Parents 39 years ago. Does that say anything about my age? So when I'm with young people like Anne Veronica, I remind them, you know, I'm your mother and I'm a grandmother, and I thank God for that. To me, the greatest fulfillment in my life is how God worked through me at a very young age and as a new, confused, and sometimes lost mother to create a platform to help parents to build strong families and communities, and more importantly, share life experiences to uplift and comfort one another and remind us that in this life, and particularly in this journey of parenting, you are never alone. I started this magazine for my selfish reasons. I really felt I needed to know how to raise up my children. I just got married, and I just had my first child, and I'm so proud that he has made me a grandmother. That's another pride of my life. But I can tell you, being a parent and a new one, and when you are young, is totally confusing. And this is why I started this magazine. My pride and joy are that Parents has helped so many people, especially in those days. You remember 39 years ago? The media was KBC. Did you know what it was called then? Voice of Kenya. Then there were 2 newspapers. And there was a standalone magazine called Parents, and a few others, but Parents has survived the test of time. But today, times have changed. We are bombarded with all kinds of media, including digital and social media, that are slowly replacing traditional media like newspapers and magazines. Never mind the value and authenticity of the information being disseminated. And this new media truly is not for everyone. A lot of people, we have an e-paper, and we know when people are trying to access it, they have all kinds of challenges. Because they say, go here, register yourself, then start here. Some of us are not used to that media. So, times have changed. And today, I have taken a back seat. More so because I'm not as digitally gifted as the young people, but I'm satisfied that I have a team of young people led by Anne and her other members of the team who understand today's media landscape and are stewarding this brand in the direction media is consumed today. One-on-one interaction through events is one of the most powerful ways of communicating. And this is the reason they are having this event today. I'm really happy, my team, that you have been able to put up this event together. How can they do this when their health is ignored? They need to be empowered, encouraged, and facilitated with knowledge and information that reminds them that their health and wellness matter. And they also need to be reminded to take care of themselves if they truly want to take care of their families. Because when you're not well, when you're not in good health, physical and mental, you cannot take care of your families. I hope that by the end of this afternoon, each of us here will be prompted by the expertise and experiences of the speakers to start prioritizing your health and wellness and to take necessary actions required of us to stay healthy. We can be told everything there is to be told, but if you don't take that first step and action, it won't happen. I want to thank you all for coming to be part of this event. I know that by the end of the afternoon, we shall all walk out of that door, those doors, there are many, empowered, knowing that we can only give the best of ourselves to those we love if we are physically and mentally healthy. And the time for you and I to take action, to commit to being healthy, is now. I welcome you all, and I also want to celebrate all the mothers in this room as we come to the end of the Mother's Month. You're all welcome.
Thank you. That is how elegance looks like. Doesn't it look like that? Kindly give her the claps. It talks about, hold. You clap thrice, you snap twice, and you blow kisses twice. When you're going to blow the kisses, iyo ya mwisho, kindly elongate it, fanya mwah. Sawa. 1, 2, go. Mwah, mwah, mwah. Thank you very much, Ms. Mathu. I work for her, and as I can tell you, I am not an employee there. I'm being trained. And working for her, working for the best person in this journalism career, I have learned so much. Kindly, now let's give her another clap. Thank you. And as you have said, as you have heard, she has said that we are having an e-paper. And the e-paper is a women's health and wellness issue. Writing about women's health and wellness is not enough. So we have to be here. We decided to come on ground and show you that this is how it looks like, okay? And since I'm still talking about great ladies over here, I would like to welcome the next lady. Many of you might know her from TV because she was the first person to found she was the first person to found a health and science media desk from the Standard. Actually, we have someone from the Standard here. Yes. So she was the first person to found the science and health desk, first ever at Standard, ensuring that this information goes to people through TV, through newspapers, and digital platforms as well. She's not just that. She's also the founder, CEO, and chief editor of the Willow Health Media. Can you guess who she is? Can you guess who she is? Ladies and gentlemen, kindly give it up for Dr. Mercy Correel. No, that's not the energy I put. Go. Thank you. You're welcome.
Thank you very much, Veronica. I think this is the advantage of having Gen Zs go before you, borrow some of the energy that they have. I hope that doesn't tell you what my age is. Please just judge me by how I look, not by what I am saying age-wise. It's such an honor and a privilege to be here. And I like what Veronica said, we are in the presence of greatness. I think all of us are a product of a woman. Who is not a product of a woman here? Who is not the product of a woman here? So when we say we are standing in the presence of greatness, it's also in the presence of our mothers, our grandmothers, our aunties, our guardians, who have made us be where we are today. And that's why we not only celebrate them this month, but we also want to, honor them by making sure that the right information when it comes to health is there for all of us. So I'm really honored to be here. It's my first time here, and I love it here. And probably Pastor Caro and Pastor Baraza, we can have a conversation that I can bring my whole clan to be here. So it's quite a privilege to be here. So we want to have serious conversations. Pastor Caro was talking about menopause, whether we can pause it. And we have the gynecologist who will tell you if it's possible when it comes to that time. And many women here who are grandmothers, probably early grandmothers, and you're wondering how to navigate that period. But most importantly, and especially for the young women, how do we make sure we remain healthy so that we have the blessings of seeing our grandchildren and our great-grandchildren? And that's the great focus of today. And we'll have really great panelists to have this conversation, to have this meaningful health conversation. When Mrs. Matthew was speaking here that she founded Parents 39 years ago, it is reminding me of my 7-month-old journey with Willow Health Media, and I'm hoping, Mrs. Matthew, even myself, I'll stand in a podium like this one day and say, 39 years ago, where Willow is coming into a space where we want to be producing and telling you authentic health content, because we live in a digital space where there's all manner of information, especially about health. I'm sure, let me just, by a show of hands, how many, when you go to hospital, either yourself or you're taking your child or grandchild, you've already consulted Dr. Google? How many consult Dr. Google? What information does Dr. Google go to hospital and you think you are dead, right? Because of the information that is there. So we want to be, as Willow, that doctor is also to have platforms like this where we bring in the health professionals who give you the right information about your health, your wellness, so that you are better informed. And Veronica said it. Women are the glue that holds families and societies. When a woman is unwell, the whole family is unwell, because chances are the children will not eat well, the spouses or the partners will not eat well, and it's a ripple effect into the society. So we want to make sure that as women, we are healthy. Even when we are caregivers to our spouses or our children or parents who are unwell, we also want to make sure that mentally and spiritually at that time, we are well, because we are the glue that holds the families together. So this is an important event, and I'm honored to welcome you into this space where we hope that faith, wellness, and empowerment will intersect. Our gathering is not just about discussions about health. It's a commitment to caring for our minds, bodies, and our spirits. I hope if you forget everything else today, remember that we are not just caring for our bodies, but also our minds and our spirits. And our health is always multifaceted. It touches on our physical well-being, our emotional strength, and spiritual nourishment, and we want to embrace that all with the support of the church community, like we are here at JCC, and also from the medical community. Today's lineup will feature inspiring health professionals, spiritual leaders, and advocates who will guide us through topics like preventive care, the importance of self-care, and we'll also hear personal testimonies that will reflect the strength and resilience of women navigating health journeys with grace and courage. And we hope that those personal testimonies will also speak to you if you're going through a difficult time, either mentally, physically, or spiritually, that those testimonies will speak to you and will inspire you to even seek further help if there is need to. And we hope that each of the sessions and the panels that we'll have will equip you with the practical knowledge and renewed strength. As we move through the program, I'll encourage all of you to engage us. Ask questions, and we'll be taking questions. Share your experience and support for one another. Let this be a time not only for learning, but also for fellowship and renewal. Together, let's create a ripple effect of awareness and empowerment that strengthens not only our personal lives, but our wider community. So I hope today will be both a celebration of health, a call to action that is rooted in compassion and faith. And those are my opening remarks. I was hoping for the clap that Veronica introduced. Thank you, thank you. So I'll take this next point to welcome our keynote speaker. Dr. Grace Kanyu will be giving us our keynote to tell us really about what to expect. It will be like the opening for the discussion and the conversation that we'll have on our health and wellness and what the foundations to a stable, healthy life looks like. Dr. Kanyi is obstetrician gynecologist. She works in Meru, and she has come all the way from Meru this morning to come and deliver that keynote in person. Let's give her a round of applause. Dr. Kanyi is an advocate for women's health. You know, when we hear obstetricians, gynecologists, we just think they'll deliver your child is well, and they go. But they also advocate for our health and wellness as women, and she's a true advocate of that. She participates in policy formulation that guide, this country about how we are going to handle women's health and women's well-being. And most importantly for me, Dr. Kanyi is a long-time friend. We started medical school together in 2006. She has been my classmate and friend for all of those years. And so it's my honor to welcome my colleague and my friend, Dr. Grace Kanyi, to give us her keynote address.
To come and give this keynote address. And that is centered on a very personal experience that centers nearly all the things that we are going to discuss today. The title is The Woman at the Center, How Your Health and Wellness Sustains Families and Communities. Distinguished guests, respectable colleagues, the incredible men and women gathered today. I was taught it's always good to start these things by telling you a real life story. When Mrs. Eunice mentioned 39 years ago she started Parents Magazine, I think my mom must have been expectant with me. Mentioned 39 years ago she started Parents Magazine, I think my mom must have been expectant with me. You'll guess my age, we're around that time. Now, fast forward to the year 2025, you have your own set of chronic diseases to deal with, diabetes, hypertension, and childhood asthma that you still have. You are really acing it in your career and growing pretty well, actually joining the technocrats of this country to write policies that guide reproductive health care in this country. And one of the most recent one is how to use obstetric point of care ultrasound. When you come to maternity, we are able to look at your baby right there and we tell you what's going on. And then you receive that phone call that your dear parent is quite unwell. And it hits you, but he has never called me ever to say he's unwell, so what's going on? But because you're the bright child that he took to medical school, you actually know something horribly wrong is happening. And as a family, you start a very important journey from the 22nd of March that I know quite a number of you may actually relate with. There's a terminal illness to be dealt with, and it stops you right into your tracks. So as a woman dealing with her own health issues, how then are you going to support your parent? Women are the heart of families, the backbone of communities, and the force behind progress. Yet too often, we give tirelessly to others, be it at family, at work, and even society, without replenishing ourselves. Today, we shift that narrative. A woman's health is not just a personal matter. It is the foundation of strong families and thriving communities. When we prioritize our well-being, we create ripple effects of strength and stability. But too many women operate in survival mode. I'm sure you'll relate with this. Pushing through exhaustion, neglecting self-care, and carrying other people's burden without a pause. Today, it will be time to redefine self-care as a necessity and not just as an afterthought. More so, professional women invest incredible energy into their careers. Whether they are serving in leadership roles, they will ace those jobs without ever asking, am I prioritizing my well-being as much as I do at work? Non-communicable diseases like diabetes, hypertension, heart disease, and cancer pose significant risks. The long hours at work, the high stress levels, the economy is one of them, the irregular meals, and limited physical activity contribute to these conditions, and the pressures of balancing work and life often result into unhealthy habits. Obesity is a multifaceted issue, and it's beginning to become a global crisis which is projected to affect over 1 billion people by 2030. That's 5 years' time. And with it comes a host of the above-mentioned diseases. I believe Dr. Caroline Mithi has joined us. She's a diabetologist and an obesity specialist, will help us explore prevention and management strategies of these common and communicable diseases. She will be joined by a respectable nutritionist and wellness coach, Emily Wahome, to highlight the 3 pillars of health: smart nutrition, physical exercise, and adherence to treatment once one has been diagnosed. While you join and listen into that panel, please ask about the proven options on sustained weight loss. Currently, we are having quite a craze in the country. Which way to go? Lifestyle coaching, gastric balloon, gastric sleeve surgery, or can I get the shot of Ozempic? We cannot have a women's event and fail to highlight on those very important issues that I know you want to hear about. Polycystic ovarian women affects many women but remains widely understood. Yet it is the most common disorder among women of reproductive age who may suffer in silence. While you sit here, you may want to pay attention to that panel if you are beginning to notice my periods are quite irregular, or possibly I haven't had a period for the last 3 months. I'm not on a contraceptive and I'm not expectant. If you're having some excessive hair growth on your face, bought a ton of skin products, but that acne and just difficulty in losing that weight. And if you've been trying to conceive and nothing seems to be coming out of it, join us in the panel to understand more about PCOS. We are all going to hit the 50s quite soon. And with it comes this memory fog. With it comes this anger outbursts. With it comes hot flashes. We keep on saying you're 56 years old, but your hotness comes in a flash. Menopause is a natural transition, yet it remains one of the least discussed phases of a woman's life. Yet it brings unique challenges that requires awareness, preparation, and support. You will hear more about this condition, which is a natural phase of life between the ages of 44 and 55. On average in our country, it's at the age of 52. But in practice, you're coming for a refill of very strong painkillers. Endometriosis affects 1 in every 10 females. If we are to do 1 in every 10, I'm sure we'll get quite a number here. It then takes another 7 to 10 years from the time when endometriosis symptoms first appear to proper diagnosis. These are women who suffer silently. And if it's a school-going young girl, she misses out on classes. If it's a female in the workforce, she misses out on work. And worse still, if you have an employer who doesn't understand it, you're likely to get those show cause letters. Too often, endometriosis is misunderstood, overlooked, and even dismissed as normal part of menstruation. But we shall shed more light on this condition as we stand together to create together in empowerment, awareness, and action. It is not just a painful period. Endometriosis is a chronic condition that affects physical health, mental well-being, and the daily life of these women who suffer for so many years. Yet with treatment, we have seen quite a number of women for the first time telling you, I'm able to go to work without missing work duties. I'm able to take care of my family without having to crawl up on the couch taking painkillers. Elizabeth Kiuna, where are you? Elizabeth? Now, there's been a very interesting clap that we have been told to give. I will ask us to give 3 hearty claps to Elizabeth before I introduce her. Can one person survive 3 cancers in one lifetime? She's a breast cancer survivor, an ovarian cancer survivor, and a cervical cancer survivor. From her story, you will be inspired. She's a true champion, a fearless fighter, and possibly one of the very few who can officially say she's stronger than cancer 3 times over. Her journey is a testament to courage, grit, and unshakable spirit. I hope you actually listen into that powerful story. And from anyone who has ever had to take care of a cancer patient or to go through cancer treatment, our hearts actually go out to you. It's not one of the easiest of journeys. Breast cancer is more than just a health concern. As with any other cancer, it will affect families, communities, and society as a whole. It is the leading cause of cancer among women in Kenya, affecting 16 out of every 100 women. And the biggest challenge is late diagnosis. When detected early, treatment success will be far much higher. The sad situation in this country is that 7 out of 10 cancers are always diagnosed at an advanced stage. We have Dr. Anthony Derito, Dr. Catherine Nyongesa was meant to join us to shed more light on how do we actually self-examine for some of these cancers, to shed light on available screening modalities that all of us should be able to embrace, so especially for those aged 15 to 45. The saddest trouble, we know HPV is what causes it, and we know we have HPV vaccines. As a country, we introduced HPV vaccination in 2019. By the year 2021, 44% of girls had received the full dose. We still look forward to a time when we can say we have 100% coverage of our HPV vaccine to be able to eliminate cervical cancer. In that panel, we will be discussing more about screening options for cervical cancer to improve on the marginal number of 16%. Out of every 100 women, only 16 have been screened for cervical cancer. Yet, it's preventable. Yes, we have screening options which are easily available at nearly every facility. Be sure to join the gynecologist, Dr. Nyongesa, and Dr. Derito in that very important panel. Once in a while, your body will decide to be a drama queen. And as a drama queen, it will decide to actually just go out of tune. Our immune system is our best friend, and it's meant to protect us against diseases. But once in a while, that immune system gets confused. It just doesn't know which is the bacteria I'm supposed to fight and which is the normal cell I'm supposed to fight. When it attacks the pancreas, the person ends up with type 1 diabetes. When it affects our joints, we end up with rheumatoid arthritis. When it affects the nerves, we end up with multiple sclerosis. We are joined today by Dr. Sahondra Kiplagat to bring deeper understanding on autoimmune diseases. Despite that, she is an accomplished lecturer at the University of Nairobi who has battled multiple sclerosis with resilience and so much grace. You should see her. She's amazing. Her journey proves that autoimmune diseases do not define a person. They're just part of a larger, meaningful life. As we wear many hats, sometimes we are caregivers, we are professionals, we are mothers, we are daughters, we are wives. We tend to put our health in the back seat. Like I've earlier indicated, we push through exhaustion, we neglect self-care, and we battle very heavy battles silently, believing that endurance equates to strength. The modern woman of today knows, I don't want to be a strong woman. True or false? True strength is in recognizing when to pause, when to reflect, and when to prioritize ourselves. Therapy has long been misunderstood, with many women carrying their burdens alone due to stigma or fear of judgment. Yet seeking guidance and processing emotions is an act of empowerment. Whether through counseling, self-reflection, or wellness practices, therapy enables us to break limiting beliefs, reshape our narratives, and step into our full potential. A thriving woman is one who nurtures herself mentally, physically, and emotionally. Dr. Joanne Carrera, a counseling psychologist with Pastor Dennis Barasa, will demystify therapy, offering insights that will inspire you to set time aside every month to come home to yourself. What we know, what we have discussed, requires us to have some form of money. Because, well, I work in a county government hospital. The era of telling people healthcare is free doesn't really exist. We actually have to pay for healthcare. Yet, investing in health is a commitment that must never be postponed, not just for ourselves as women, but for those who depend on us. Healthcare challenges, ranging from maternal health to chronic illnesses, still remain prevalent and will affect a woman at one point in her life. The rising cost of medical care means that without insurance, accessing proper treatment can be financially overwhelming, draining to pay out of pocket. Whether managing pregnancy complication, tackling any lifestyle disease, or just going in for a routine checkup, that medical insurance will ease the financial stress and ensure that no woman ever has to choose between her health and her other responsibilities at home. I am purely a civil servant, not a government agent. The Kenya's Social Health Insurance Authority is working towards universal health coverage, ensuring accessible care for all. SHA covers maternal health and specialized treatment, making it essential for women's well-being. Private insurance, while requiring financial investment, offers flexibility, broader coverage, and faster access to specialists, particularly valuable for women managing chronic conditions or seeking tailored maternity care. Regardless of the option, medical insurance ensures security against unforeseen health challenges. Medical insurance is just not an expense. It's an investment in your health and financial security, providing access to necessary care and protecting you from potential. This is one of the panels you want to be part of. If you are to even think of paying for one of those chronic illnesses, or even a family member or a child who has been involved in a road traffic accident out of pocket, you'll realize very fast your savings will be running out. And as a practicing clinician, one of the things that breaks our heart is when families want to withdraw their significant family member from care because of the rising bills. Now, I started with a story. That story was not actually fictitious. It was actually a real story. The person standing in front of you not only has her own set of chronic diseases, but has had for the past 54 days walk the very difficult journey with a parent. Thank you, and may each of us walk forward with confidence, security, and the knowledge that our health is our most valuable asset. When you look at me, you will actually think everything is working on well. But trust me, when Dr. Joanne says get into therapy, we understand what that means. When Dr. Caroline states, please come in for your clinical reviews, you still have to get your insulin shots, it's because despite you supporting someone else, as a woman, you still have to take care of yourself. When women are well, society flourishes. When women are prioritized, the future is brighter. And when women rise, they lift the world with them. Today, let us set the tone for this event's theme, Women, Health and Wellness, with a renewed commitment. Let us challenge the norm, uplift each other, and make intentional choices that honor our being as women. Because we, the women at the center, are the key to holding stronger families, healthier communities, and a better world. We must be guardians to our own health. Thank you.
No. Wait. Let's give her the Gen Z clap. Wait. Veronica, you're the choir master for the Gen Z clap.
Okay, let's do this. Can you hear me? Nice. 3 times, and the last time you make it long, okay? 1, 2, go.
Let's give Dr. Kanyi her flowers. Thank you very much, Grace, for sharing your personal story and setting the tone for this next conversation. I'm guessing we can set up the panel right now, Veronica, so that I can invite the panelists for the next conversation. In the next 30 minutes, we'll be talking about the diseases that I don't want to use the word cripple, but those that are debilitating to women. And in this case, we'll be talking about cancer, and we'll get to hear Elizabeth Kiuna and what her experience has been. From Grace's, Dr. Kanyi's keynote, for me, one of the key things that stood out is that self-care is a necessity. It is not an option. Mulisikia huo ujumbe? Self-care is what? Self-care is what? I want to hear the women say it louder. Self-care is? Please make sure you are always looking after yourself, because she says, and I also said, when a woman is unwell, everyone in the family and in the society is unwell. And then empathy for women's experiences. And this particularly for me goes to the employers in our midst. When a woman is saying, you know, I'm having a painful period, I'm not able to work, we need to understand, because we know endometriosis, adenomyosis, and those diagnoses are very difficult for women, right? So empathy for women, especially for employers, and we should also be empathetic to ourselves and be kind to ourselves. And the holistic approach to women's health, and that health is a valuable asset. One of the things that I've learned being in media and doing many people's stories is that your health is very personal. When you're unwell, you cannot share it. As mothers, when your child is unwell, you usually feel like upewe huu ugonjwa so that your child feels better. Sindio? For the mothers who are here and have had a child who's unwell. When my son was, I think it was 2 months or a month, actually a month, he was 2.5 kg. He had to undergo an emergency surgery. So you can imagine, I didn't leave the recovery area. I almost went into theater with him, but I couldn't, of course. The surgery wouldn't have gone on. But at that point, I was feeling like, I'd be given his experience, I'll go through it, and so that he doesn't have that experience. Health is personal. When you're unwell, it's only you who's unwell. Sindio? And when you're feeling okay, you're also feeling okay. And by gynecologist, let's give her a round of applause. Gynecologist, let's give her a round of applause. She'll get to tell us about what that self-care is, some of the Dr. Google that we have been looking at. So Dr. Mutahi will be able to dispel some of those myths and misconceptions. Dr. Antonin Nderitu, who's an oncologist, karibu sana daktari, and we'll get to hear about cancer diagnosis and what the treatment advances are there for women. Last but not least for my panel is Dr. Geoffrey Mutuma. Is Dr. Mutuma in? Is Dr. Mutuma in? Okay, all right. So we'll get the conversation going with the 3 panelists here. Everyone has a mic? Elizabeth, do you have a mic? Excellent. So let me start with Dr. Mutahi. Before we go to Elizabeth, I hope all of you can see us as we move the podium. Okay. Okay. I want to start with Dr. Mutahi, the obstetrician, gynecologist. When I asked women about Dr. Google, almost everyone raised their hand. So what are the myths and misconceptions that you encounter when women come to see you, particularly about women's cancers? What are some of the things that Dr. Google and even our own chamas and gossip spaces that we tell women when they come to you?
Thank you very much. I'm grateful to be here. One of the myths that we hear or we get to hear is that I'm too young for cancer. I don't need screening, and that cannot be further from the truth. Basically because the issue with the women, the cancers that affect women, is that most of them will be discovered later in the stages. For example, ovarian cancer, 70% of them will be discovered in stage 3C. Of course, when you hear the stages, we have heard about the stages out there. So basically, by the time we are stage 3, it's to mean you're further along the line. So the other thing is that, the other myth is that we hear there is hope in not knowing. When I ask my patients, okay, why have you not had a pap smear? They tell me, Daktari, you know what? There is hope in not knowing. I don't want to know now, and I weep, when I hear that, because again, most of the cancers in women can be treatable, and curable, okay? But if found earlier in the stages, okay? And that is why we are encouraging our women, or our mothers and our ladies, let us all get screened, especially for pap smears, or what I would say cervical cancer screening, which should be done between the age of 21 to 65. Remember I said we are never too young for cancer, right? But we can be screened and can be found in good time. Remember, cancer of the cervix will develop over a long period of time, okay? From exposure to HPV, the virus that causes cancer of the cervix, to full-blown disease, it will take 10 to 20 years. But what can we do between 10 to 20 years? In between that period is to screen. And why do we screen? When we screen, then we get to know if there are changes in the cervix that, if left unattended, will become cancer later on in life, then we can arrest it, okay? So there is no hope in not knowing. There is hope in knowing. Because when you know, we can treat, okay? When we catch it early, it is curable. But when you wait until you get the symptoms, painful vaginal bleeding, pain during sex, bleeding after sex, or foul vaginal discharge, by that time, you're far gone along the line, okay? Yeah, so I think those are among the myths that we hear most.
That ignorance is bliss. That's what we, if I don't know, then I'm okay, right? So we will get to know and get to do the screenings when there's need be. Dr. Before I go to Elizabeth, the issue of HPV, and I've had parents ask me, especially when the government was rolling it out, should I let my teenage girl be vaccinated against HPV through the HPV vaccine?
Yes, absolutely. I would encourage that we have our daughters, and if resources allow, sons to be vaccinated. Why? Because the HPV is the vaccine that causes cancer of the cervix. At least 99.7% are attributed to HPV virus. Yeah? Okay. So if we vaccinate, we can stay away from it.
Okay. Now let me go to Elizabeth. Breast, ovarian, and cervical cancer, we applaud you for being a warrior and, for also being willing to come and tell us your story. What barriers, challenges did you face, getting diagnosed and getting care for these 3 different cancers?
Okay. Hi, everyone. My name is Elizabeth Future Kiuna, a 4th-year student at KC University pursuing Bachelor in Journalism and Digital Media. Back to your question. Okay, some of the challenges that I faced. Okay, the biggest challenge was denial. I was in denial. It was so hard for me to accept that I had cancer. But, okay, financial, the society that was around me as well. The challenges were too many, but the ones that really affected me was denial, financial, and the society.
How did you get to know that you have cancer?
Okay, back in 2012, I started bleeding while I was in class. My breast was bleeding. I was fat, let me call it fat. So I started bleeding, and when I went home, I was taken to a local facility. Then I was given some medicine that I used, like a robe. Then I didn't know right from there. When I was back after some years, now in 2017, when I was already in high school, the same thing happened again, and I had lost a lot of weight. Then I was in Mwani Girls. The deputy said that I was supposed to be taken to Water Level 5 Hospital, and that's when they told me that I was supposed to go to Kenyatta. I went there with my grandmother, and she's the one who was given the results. Yeah.
Sorry for that. So what did your grandmother tell you? How did she tell you this information?
Okay. My grandma just told me, kunywa dawa ama utakufa. Yeah, that's what she said.
Okay, I'm happy that we can laugh about it now, that she's well. But I think those are some of the things, you know, when we don't have the right information. And Joanne, you'll be able to address that. How do we empathetically and compassionately, you know, deliver these stories? So we'll come back to you, Elizabeth. Let me come to Dr. Githinji about diagnosing cancer. Sometimes, and you know, the experiences that women have, you suspect, but you're not sure. What is your role in confirming or telling the women that, you know, this is cancer or this is not cancer?
Okay. I want to make a correction. I'm not Gedeji, I'm Deritu. I think that was a typing error. Yeah, so I'm Dr. Deritu. I'm a clinical and radiation oncologist. In the cancer journey, we have a lot of what we call, it is a multidisciplinary kind of management approach, where there are those who make the diagnosis, there are those who do the treating, there are those who do the counseling and all that. So in terms of a patient who comes, or somebody who is suspecting I could be having cancer, or I'm having a concern, I am having bleeding, I'm having pain, maybe we are talking of the cervical cancer. We know the two most common cancers for women is cervical cancer and breast cancer. Breast cancer being the most common, followed by cervical cancer. But if you look at the number of deaths, you'll find the deaths are mainly, there are more deaths from cervical cancer than breast cancer. And that is a major concern, because overall, even among the men and women, the women cancers are the most common. And if you're having almost 15,000 cases of cervical and breast cancer combined, and more than almost half of them die every year, that is a very concerning number. And that is something that we all need to act to help curb that menace. But in terms of our role in management of these patients is that you have come with a suspicion. Maybe you're having a lump in your breast, or you have the bleeding like she talked about, or you have pain. The first thing is you go to the nearest health facility that you find. Once you go there, you may not find an oncologist, you may not find a gynecologist, but with more education and more awareness, the healthcare providers are able to navigate you to where you can get help. And then here now we help you go through the process of making a diagnosis. You are examined, you have a biopsy taken. A biopsy is some tissue that is taken. It is taken to the laboratory. The pathologist comes in there to help make a diagnosis. Once we make a diagnosis, we have the other experts, the radiologists, who will do the scans and all those other investigations that will help us know how far is this cancer, if it is cancer and it is confirmed. Once that is done, through this process, you also take you through the counseling so that you come to terms with what is happening, so that you are also part of the journey and you are able to be navigated through the treatment.
Okay. Thanks for taking us through that. Dr. Mutahi, on your role as a gynecologist, what is it in making sure there is early detection and prevention, even when you're in your individual clinic or even if it's a big facility? What is your role? Because you'd said, you know, if it's caught early, then it's manageable, it's treatable. If it's late, then things are really difficult, both physically, emotionally, and financially.
I think one of the conversations we've been having as gynecologists is we are encouraging each other, take 2 minutes and look at that woman's cervix. That is a conversation that is going on with us gynecologists, because one of the things that we found from the level 1, 2, and 3, by the time the patient gets to a gynecologist, this patient has been treated for, daktari niko na kakitu kamefura, and then the doctor says, shika cream ukapake, you know. And then she will show up 7 years later with a huge cancer of the vulva, okay? So one of the issues is that the doctors are becoming more and more proactive with examining their patients, being up to date with the current trends of treatment, being more and more current with the modalities of screening, okay? And the other thing we've done, for example, in my clinic, I always, for my patients who are coming for postnatal clinic at 6 weeks, that is a perfect time for me to do a pap smear, because after that they have given birth, and probably I'll see them again in their next pregnancy, and I don't want to miss that chance to just screen. So, and also for the patients, be your own advocate. When you go to a doctor and you have something that is growing, ask the doctor, unaweza angalia? And it will go a long way. You know, even if you find that doctor is not keen on examining, be your own advocate. Ask your doctor, I have this and that, what do you think? Go for your medical checkups, okay? We are open, we are going to be there for you, okay? Thank you.
Thanks, Dr. Elizabeth, through your journey with various healthcare providers and professionals, how do you think they can better support women and somebody like you emotionally, especially when you're at that stage when you're in denial and you also don't know what's happening? How can they better support you through that journey and process?
Okay. One very important thing I know, healthcare providers play the biggest role during this time. And from my own experience, I would say that what I would request them to do is telling the patient the truth. Tell them what they should expect. Don't lie to them. Don't tell them those sweet words. Like, I know they care about us, but I would prefer if she tells me, if you don't do this, the same thing my grandma told me, if you don't do this, you're going to, than telling me, oh, you see, you go to the hospital, like I used to go to the hospital, my breast is bleeding, and the doctor tells me, just use a cotton, you'll be okay, wait for the next patient, you see. But I would really prefer if she told me, this is worsening, like, you get, yeah. So I really pray and request the healthcare providers to just tell us the truth. It is better the painful truth than the sweet lies, because by the end of the day, you're going to know the truth, and it will come out soon.
So what did you do to move from a point of denial to acceptance so that you can successfully go through your treatment?
Okay, this is what happened. There is this number that I had, and it used to send me a lot of Bible verses. So I decided to call that number, and his name is Hussein. He works with BF Suma. So I called him and told him, by then I thought he was a pastor. So I called him and told him, okay, I have cancer and I don't know what to do. So he gave me a number for Allan Jerry Mwingwi. I know you know her, the founder of Uskimia Foundation. So she came to school that day, still in KCM. She came to school, picked me up, and took me to Faraja Cancer Support. So after the counseling, I accepted that, yeah, I was sick, and that was the start of my healing journey. Yeah.
Okay, thanks for that. Dr. Ndiritu, thank you for that. How can we bridge the gap between diagnosis and treatment, or timely initiation of treatment, so that we can save as many mothers, as many women as possible?
One thing you'll notice is that a lot of patients who come to the hospital, we say they have come to the hospital late with their cancers. Most of them will have seen one healthcare provider or another, maybe at a lower level of hospital. What we usually do is that we encourage and we do a lot of capacity building so that even at the lower levels of the hospitals, they can be able to suspect and navigate a patient through to where they can get care. In terms of helping these ladies to get to the proper care early enough, first of all, is to have advocacy, a lot of advocacy, this being one of them, to help them know that even if you get this diagnosis, if it is captured early, it can be treated and cured. And there are many testimonies of those cases which have been diagnosed early and cured. So the first thing is from yourself. Know yourself. We usually say, like, if it is your breast, know your breast very well. Be aware of your breast so that anytime you notice something different, you should be able to seek help. If it is the other cancers, know what are those signs that are not normal. It is better to go to hospital and be told this is normal than staying with something that you're not sure what it is. So the other thing is, be afraid of the healthcare providers. Be afraid of the doctors so that they are able to navigate you early enough. The other thing is, from the healthcare providers, is for them to be well aware that cancer is here with us. Cancer is the third leading cause of death after infectious diseases and cardiovascular diseases. So it is a major cause of health issues in Kenya. And we should be very well aware, even at the lowest levels of hospitals where patients will be able to go. So from the healthcare, it is to make them aware that the cancers are here and they are this common, so that they have a high index of suspicion. From the person themselves is to look at anything that is not abnormal, that is not normal. Go and seek help and be advised whether is it normal or not normal. Then after that is to adhere to the advice given. If you're told you need to go for biopsies, go for biopsies. The other thing is access to this care that we are talking about. It is not cheap. So from the government side is to increase the resources so that ladies are able to access the diagnosis. The diagnosis is a part that had never been covered very well, so that they are able to get access to the specialized tests that they need, and also the treatment. But somebody talked about, I think she talked about SHA. SHA actually, as much as we want to say that, I know people say it is not working, but I can tell you it works. So if you don't have SHA, please get enrolled in SHA. And it is getting to pay most of those costs. Of course, there are those problems that may be there initially, but all in all, I know my patients have been benefiting from SHA. I'm not talking on behalf of government, but I work for government too. But I'm saying because I know it works. I work in Kenyatta National Hospital, so I know SHA pays for patients, so it is good to have those health insurances that may help. There are other private health insurances also that help cover these things. If it is your parents, get them enrolled in these insurances. You may need them at some stage.
Okay. Before I let you go, Doctor, you've talked about people to seek care. Is this care available within the borders of Kenya? Because we get many people get diagnoses and they're on the first plane out to India. Are these forms of treatment and care available within the Kenyan borders? And if so, are they as advanced as you would want to when people are seeking care outside?
Over the last couple of years, let's say about 10, 15 years, the advances in healthcare in Kenya, it has advanced so much. You have a lot of diagnosis being done right here in Kenya in terms of the scans that we do. There are scans that people used to go to India, let's say like what we used to call the PET scans. Now they are available. There are several centers in Kenya, not even one, which is doing those specialized tests. In terms of training, we have very high quality trained medical personnel, ranging all the way from those who do the diagnosis and those who do treatment. I can testify that most of the specialists we have, even in the field of cancer, they are trained at the highest level that we can talk about, talking about the oncologists, the gynecologists, the surgeons. So we have all the experts that we may need for diagnosis and treatment of these diseases. In terms of facilities, in the region, Kenya is quite ahead of most of the countries that we have in the region. And you'll find most of the treatments that need to be done, most of them are available in Kenya. Maybe very few that you may need to go for outside. But a lot of those cases that you see going outside, most of them is not having adequate information on where to access this. The other thing is perception. Over a long time, people had that perception that you can't be treated well in Kenya. But the experts are there, the facilities are there. The other thing is that there are those, let's say, medicines, the cancer medicines that may not be available in Kenya. Instead of going outside, the drug can get here faster than you going for it there. So, and the experts who administer this, they are available in Kenya. So to answer your question is that these services are available, the experts are there, but in case you need to go out there, discuss with your primary doctor or your oncologist or your surgeon or your gynecologist. They'll advise you, this is available here and here. Whatever is not available, the doctor has no reason not to send you to where it is, where you can access it.
All right, thanks, Dr. for that information. And for Dr. Mutahi, how can then the private gynae clinics or the clinics in the hospital run by gynecologists, how can they be integrated into other programs? Because if we have PET scan, we can only have so much. If we have, radiotherapy treatment, it can only be so much. So how can that system be well integrated to be seamless, to be able to treat women? And I say this because if I come and see you and I get the diagnosis, I'm probably going to be told to go across town to see somebody else for something else. How can that experience be seamless, one, so as not to waste time for treatment, initiation, and management, and also just for the comfort of a woman coming, knowing that within one fold or one place, I'm able to be taken care of from prevention all the way to treatment if need be?
I think one of the ways to get women or patients treated better and faster is definitely, one, by advocacy work. Something like this, then I will get to know Dr. Nderitu, and then after that I'll get to know somebody else as a health worker, a health service provider, and from that I can be able to refer my patients or as need be. The other thing is, if we were to get these services available in our government hospitals, probably taken care of by SHA, you'll find most of the specialists are available in these government hospitals. But somehow, as the patients, we also have a notion that sitaonekana na daktari mkubwa. That statement that we tell each other out there, it is not true. I think we also need to change our perception of the healthcare system.
Okay, thanks. And Elizabeth, to the women who have come here, they're listening to you, what advice would you give them about listening to their own bodies and being advocates for their own health?
Okay. What I can tell them is, first, don't be scared. Don't be scared to do the screening. Don't just ignore your symptoms. I know our bodies react differently, but that very first warning should be a wake-up call to every one of us. And have in mind, even when the results turn out the way you don't expect them, raise up your head and look forward. Think about you. Don't take any negative comment. Even when they tell you that is the end of you, please just remember that you matter and no one else matters more than you do. So that is all what I can tell you. Yeah.
Thank you very much. Let's give her a round of applause. Dr. Mutahi, what advice do you give to the women listening to you today?
I think for me, one of the messages I would want out there is get screened. Get screened, get screened. I cannot say that enough. Get screened, okay? Because there is help after screening, okay? Most of the cancers are treatable, caught early, and curable, not just treatable, treatable and curable, okay? So get tested, get screened, very important.
Thank you very much, Dr. Mutahi. Let's give her a round of applause. Then, last but not least, Dr. Nderitu, what advice do you give the women listening to you?
If we look at the most common cancers, they are cancers of women, that is breast. And if you look at the top 5, you have the breast, you have the cervix, you have the ovarian cancer. There are also those others which are shared between men and women, colorectal cancer, cancer of the esophagus. And then somewhere there you have the prostate cancer, which is mainly in men. If you look at the 2 most common ones, they are preventable, they are screenable. You can be screened early enough. If it is breast, it is very easy to screen. There is what you call breast self-examination, which you should get trained on how to do it so that you're able to examine yourself every day or every time when you're taking a shower or something like that. If it is the cervical cancer, the symptoms are very clear. You'll be able to notice them very fast. So what we are saying is that be aware of your body, be afraid of the healthcare provider so that you get help in case of any problem. Remember, what was said earlier that what you don't know does not harm you. It is not true. If it is a cancer, if it is there, it is there. Let it be diagnosed early and treated. If you go there and it is not found, then you're in a safe place. But be aware of your body, seek for help if you need to.
Okay, thank you very much. Ladies and gentlemen, let's give them a warm round of applause. Thank you for telling us about cancer. The message is get screened, get to know early. Ignorance is not bliss. So thank you, ladies and gentlemen. I'll allow you to take your seat as I welcome the next moderator for the next panel, Dr. MJ Wanjiro, who's a pharmacist, communication and community wellness advocate. Let's give her a round of applause. She will take us through the issue of lifestyle, mental and spiritual wellness. Karibu sana.
Thank you, Dr. Korir. Before we proceed, I'll request for 2 more chairs, please. My panel is a bit more than the previous one. Now, the problem with coming after Dr. Korir is that those shoes are just too big to fill. Nimepanic, msinione hapa. But even before I officially take over from her, Dr. Korir, I really want to thank you. I don't think you know the impact you have in my career. I think I was maybe 17 years old, thank you, fresh in campus. I had just gotten to pharmacy school, and I was really burdened by, do I leave communications? Because I really wanted to be in healthcare, but I also wanted to be in communications, and I felt like I needed to choose one of them. And then one of my seniors told me about Dr. Korir, and she was like, Dr. Korir is a doctor and works at KTN. I was so shocked, that's possible? I don't want to work in a hospital. So Dr. Korir, thank you very much. Please let's give her the Gen Z clap. Thank you for being such a pillar in my career. So you may be wondering who this small Gen Z is talking about Dr. Korir. My name is Dr. Mercy Judy. That title is really new. I'm still getting used to it. I graduated last year with a Bachelor of Pharmacy from Kenyatta University. You can clap. Hey, thank you. Mmechangamka. I wanted to tell you to clap for me. So thank you for clapping for me before I told you to. You would have done that either way. So I'm a doctor. I'm a doctor in that sense, but I'm also, as I've mentioned, I really am passionate about communications. The way people are coming here, Mrs. Matthew was saying she's a mother for 39 years. I'm also a mother for a 2-year-old podcast. Clap for me. It's called What the 20s. Please say What the 20s. Yeah, any 20-year-old in this room? Thank you. So it's basically a discussion of how the 20s are crazy. So if you're in your 20s or if you've been through your 20s, you know how crazy it gets, Indio. So that's what we are doing at my podcast, and I welcome you guys to join us in the journey of growth. So the discussion today, we are looking at healthcare from the holistic approach. So I am assuming most of you here are Christians because you're in a church, right? And in faith, we describe God as being the person in three. Cindy, we say God there? Correct. And we also say, because you have God the Father, do you still need the Holy Spirit? Do you still need Jesus Christ? And we are made in the likeness and image of God, right? So the same way God exists in three, we have God the Father, the Son, and the Holy Spirit. Even us as humans, we have like a holy, quote unquote, a holy trinity of ourselves. So we have the human in mind, the human in body, and the human in spirit. And just as we've said, in God, you don't, at least because you have one, you don't need the other. You need a perfect balance of all three. So also us in being human, we need a perfect balance of all three. So for the next 30 minutes, we are going to have this discussion of how to balance our body, our mind, and our spirit. So health from the whole picture of health. So kindly help me welcome my panel. It's a bit long, so msichoke kupiga makofi. The first one is Joanne Kirera. She's a counseling psychologist. Please clap for her. So she's going to take us through the mind person, quote unquote. So just clap for her until afike. Thank you. The next one is Emily Wahome, who's a nutrition and wellness coach. Thank you. Clap for her. So she's going to take us through how to take care of our body from the nutrition aspect. The next is Dr. Gladys Minor. She's a dental surgeon. Yeah, she's going to take us through oral health. And then we have Dr. Caroline Mithi, who's a diabetologist and an obesity specialist. Oh, yeah, amevaa scrubs. Makofi kwake. She's in character. And then we have Lily Murugi, who is a fire emergency survivor. Please clap for her. So I've saved the best for the last because this one you know, and Percy, the way they clap for you, you will know if they love you or not. The last member of this panelist is Pastor Dennis Barasa. Thank you. Clap for yourselves for being... Okay, so we are ready, panelists? Okay, thank you. Right, so we'll start this discussion by defining health from the holistic approach. And Joanne will take us through health as like the whole picture. Yeah, what you think it means and the misconception that people have when it comes to health, maybe looking at it from just one aspect.
Thank you so much. So health, a human being is holistic. So we look at the physical, the mental, the emotional. We also have the social and the spiritual. So those parts are interlinked because when you have deficiency in one, it affects the other. So we cannot be talking about health without looking at the spiritual person, and then we look at how you're doing emotionally, and then we look at the physical well-being, which has been discussed a lot, and then we look at how are you when it comes to healthy friendships, and how are you when it comes to lack of those. And then that combination makes a person whole and functional.
Okay, thank you very much for that. So health is not just one. We need all three aspects of it to be in balance. Lillian, let me come to you. You have a very powerful story about how you survived the 2024 Embakasi explosion. So kindly share with us your testimony, your story, how you survived the accident, and the challenges, especially the mental trauma that came because of that experience.
Okay. As you have heard, my name is Lily. I was involved in the Embakasi explosion, which happened on 1st of February 2024, which I was healed for 6 months in bed, without walking, without taking care of myself. And then when I was in that bed, I had to think and have a conversation with myself and God and ask God, this is how I am. I can't walk, I can't move, and my legs are totally damaged. and I have to accept myself. So it began by accepting myself and just asking God for healness. And that is not the end of the world, because I remember the day the incident happened, when I was lying there down, I asked God. I said peace with death, and I asked God that, is this how I'm gonna die? And I was just lying there, and I just said peace, and I closed my eyes. The next thing I could see is a burning metal in front of me, and that's what woke me up, and I ran.
Okay, thank you for sharing your story. That must have been a bit hard for you, but thank you for your confidence. And Joanne, back to you. Because of such an experience, especially when she said, for 6 months she was in bed and she couldn't do anything, she was going through a lot of mental, challenges, the emotional, psychological, it's really a lot, right? So maybe when somebody goes through such a traumatic experience, what do you think are the challenges they face, especially psychological, and what can we as maybe their caregivers do to help them through such an experience?
When any person is faced by crisis, they respond differently. They could run, which we call flight. They could freeze, which, you just are there doing nothing. And also, there are some people who just make peace. Not like you agree to it, because all of us will go through shock and denial and eventually grow into a place of acceptance. But basically, some people just sort of agree with it in their not good mental space. In some cases, then people fight. A few people will fight. But mostly because the initial response to crisis is shock and denial, people need a lot of support around it. But I believe as community, as society, most of the time, in our own shock, we might judge and not be supportive to them. And sometimes, if there's no way you can support, just be present and do nothing and say nothing. Because in our own shock or in our not knowing, we can say things, we can appear judgmental, we can try to make peace so fast, we can tell them to accept pretty quickly things that are not possible for someone who is going through crisis or suffering. So if you do not know what to do, just be present and say nothing. But if you must do anything, ask the person the kind of support you can give them. What do you need right now? Do you need to talk? Then give them space to talk. Do you need to cry? Then give them space to cry. Do you need to say nothing? That is perfectly fine too. So because we do not know how people respond and people are very different, allow them to let you know how to support them, or simply do nothing and just be present.
Thank you very much for that. Pasi, one thing that Lily has said is when she was having, when she was recovering, on the road to recovery, she used to have conversations with God, So what is the role of spiritual well-being when it comes to the overall well-being?
Thank you so much. Let me begin by saying this, that we need to understand, like you began by saying that the same way the Godhead is tripartite, even man. So we need to understand that man is tripartite: spirit, soul, body. So that's the way God ordained it, in that order. So when you look at 1 Thessalonians 5:23, the Bible says, and may the God of peace sanctify you wholly, and may your whole spirit, soul, body be preserved until the coming of the Lord Jesus Christ. So looking at health holistically, instead of compartmentalizing it, is what gives us that wholeness. Because you really cannot talk about wellness when you focus on one particular aspect of health or wellness, ignoring the other. So having said that the spirit man is like the king, right? Because life is spiritual. So 3 John 2, the Bible says, beloved, I wish above all things that you may be in health, that you may prosper and be in good health, even as your soul prospered. So again there we see that spiritual supersedes, right? So drawing that strength and peace from God is very, very important, even when you're going through any challenge. Because I will define then spiritual wellness as intentional pursuit of a relationship with God, aligning your inner life with His will, and finding peace and purpose in His presence. So when you are going through a challenge like she went through, right? If you're not anchored spiritually, anything you hear can actually sweep you, right? So being rooted in God then plays a key role even in times of crisis. Because if you are anchored in God, who is the source of our unchanging source of our strength, no matter what you hear, all right, you can be able to face any challenge with courage, with boldness, knowing that what you hear really is not the end of your life.
I like what you've said about being anchored to God. And most times when we go through like difficult times, sometimes it can either take us to God or take us from God. It can go both ways. So maybe what do you tell somebody who's going through a hard time, and instead of their experiences taking them to God, it's like drawing them away?
Yes, thank you. Now, experiences come at times, and to be honest, it's not easy, all right? Nonetheless, having said that, it's important to know that when crises come, when you understand that life is spiritual, when you face such a crisis, at times you may not really have the strength. Maybe let's assume you used to spend like 10 or like 3 hours praying every day and studying the word. And when you face such a crisis, at times you may not really have the strength to pray. Nonetheless, understanding that our walk with God is not performance-based, right? Most importantly is that finding, even if it's 10 minutes a day. At times you may not really be able to pray those deep prayers, but just opening and pouring your heart to God is more important than running away from Him.
Okay, thank you. Dr. Gladys, Pasi has said we don't compartmentalize our health. And I think one of the areas in healthcare that has really maybe been taken for granted is the oral health. Maybe sometimes we think because we brush teeth in the morning, it's okay. But what more can we do to take care of our oral health, and why is it important to not take it like for granted?
Hello, thank you for the opportunity. So yes, it's true that many times oral health has been seen as not being important, but that has been a misnomer that we are trying to change in the oral healthcare community. And one thing we need to realize is that the mouth is actually a mirror to your body. The reason why I say this is because the moment you go to a dentist, many times we are able to identify situations in your mouth that could lead us to a diagnosis of a bigger problem that's happening in your body. So from the mouth, you could come up with indicators, be it gums that are bleeding, ulcers in the mouth, discoloration, change in the structure of the mouth, a dry mouth. It could lead us to identifying problems that are happening in your digestive system, in your mind, especially when someone is very stressed. Your body will keep record. You'll come in complaining of jaw pain, teeth that are broken, or even other situations like feeding disorders could be identified from the body. Diabetes has most times been picked from a dental visit. It was an incidental visit. You went for a checkup, and whatever we find in your mouth leads us to identifying situations that are more than you thought you had. Heart diseases, even some cancers in the body have been picked from the mouth. So yes, the mouth may look like a small part of the body, but it is actually a mirror to your entire system. So how to better take care of ourselves, I would advise that we make a point of visiting a dentist at least once a year. It doesn't have to be a private practitioner. I know many county hospitals now have dentists attached in those departments. So make a point, visit your dentist and walk the journey. You never know what could be found in your mouth that could lead us to a bigger situation in the rest of your body.
Do you guys go to dentists? I've never, in my 20-something years of life, but I'll start going to a dentist to Meniambia. Speaking of mouth and food goes through our mouth, Emily, let's talk about diet culture and how all of a sudden, how many are on a diet? I know you wouldn't say, but me, I've tried so many diets. I've done keto, I've done what. We're doing so many things because we're looking for quick fixes, right? So there's Ozempic that has come up and just like a lot of things that are coming up, quick fixes to our bodies to help us look better. So maybe take us through that, what you think from an informed point and your advice to us.
Thank you. I'm seated on a very hot seat because of very many quick fixes that are there. If you get your phone right now, you can get very many things that are going to help you, and they are giving you miracles, You can lose 10 kilograms in 1 week, All these things are there online. But what I can say about quick fixes, because even patients, when they come to clinic, a patient will come, of course, when they have visited Google already. They'll come and you're trying to tell them the healthy way of losing weight, but some of them really insist. Many patients are insisting on the gastric balloon, and they will insist and insist. So the gastrologist sometimes, they will give them the balloon. But then the nutritionist, I have to tell you the truth. As much as you're fixing this balloon, yes, you'll have it for some time. It will make your stomach smaller, so you will not have larger portions. But what is a long-term? What is a long-term sustainable way of losing weight and keeping a healthy weight? As a nutritionist, that's what I'm interested in. And even your health, whatever method you're using, is it impacting your health positively or negatively? Some of the quick fixes we are having, they are depriving us of very important nutrients. Sometimes even the fasting that we do, you can do a healthy fast, guided by a nutritionist or your health practitioner, but some of the things we are doing, we are depriving ourselves very important nutrients, minerals and vitamins that are supposed to help us with our immunity. So what I can say is that if you are interested in losing weight, please visit the healthcare practitioner, visit the experts, get the right information of how you can lose weight. You realize that we don't also gain weight within a week. So we can't lose it within a week. We need to have a practical, long-term plan of how you can lose weight in a healthy way and sustain. That is the most important thing. The quick fixes work. The Ozempic, if you come and insist, the doctor will give you the Ozempic. But at the same time, when you finish taking that dosage of Ozempic, Ozempic is a drug that has been used for treating diabetes. But what it does for weight loss, it puts your appetite down. That's how now people lose weight. So for that period, when you have Ozempic medication, your appetite will be down. But when we withdraw, then your high appetite comes back. And then you're having your large portions, you're not doing exercise, and there is nothing else you're doing. So you keep coming for Ozempic, on, off, on, off. So the only sustainable weight loss, work with a nutritionist or a dietitian. They are there, and they will help you to have a sustainable, healthy weight loss journey. And it is possible. I have worked with so many clients who have sustained a healthy weight after having obesity. So it is possible. Thank you.
Okay, thank you. Speaking of diabetes, let's move to the diabetologist, Dr. Mithi. The lifestyle diseases, what are we supposed to look out for? How the hormones interact with our habits? Yeah.
Thank you for that. So the lifestyle diseases include diabetes, hypertension, and now obesity has actually been listed as a lifestyle disease. And so things to look out for. I have to say that these are silent diseases, meaning you actually have to go and get checked to realize that you have them early on, and later on then they come with complications. So some of the symptoms of diabetes that you'd want to look out for: are you excessively thirsty? Are you excessively hungry? Even as much as you eat, you just feel hunger. Are you losing weight or gaining weight very rapidly? Are you going to the bathroom to pass urine very frequently? And do you have a family history of anyone with diabetes? So you'd need to go in and have a diabetes check. and to avoid the complications, and such complications will range to kidney failure, leading you to dialysis, leading you to transplant. You can have heart attacks and strokes. You can have amputations. So before we get to the complications, then we ask that you come in, just like we've had in the first panel, screening for cancer. Also come in and have yourself screened for diabetes and for high blood pressure. Obesity, I want to take up from what our nutritionist said. So now obesity is a disease, and the backbone of our treatment is actually diet, that is nutrition, because that is sustainable, and also exercise. And what we tell you is at least every day exercise for 30 minutes a day, and that will be sustainable. I also have to say that now there is medication for obesity, especially for patients who really need it and who have other comorbid conditions, maybe diabetes, because these medications were initially postulated for diabetes. So if you have those, then there is medication, but we take you through the side effects. For example, did you know Ozempic can actually cause blindness? You know, it can cause thyroid cancer. And so before you're actually put on this medication, then we'll have to screen your eyes. We screen you for thyroid cancer. And so I agree with Emily that you'd actually have to go into a healthcare provider. We do the initial assessments before actually putting you on this medication. But even after we've done any weight loss therapy, whether it's medication or surgery or balloon therapy, remember what will sustain is the nutrition and the exercise at the end of it all.
Okay. Picking up from nutrients, basic science, Emily taught us that we need like a balanced diet. So we need our carbohydrates, we need our protein, we need our veggies. But now when I'm grown up, I see I'm supposed to cut down on carbs. So how do I honor like the traditional Kenyan foods, but still do it in a nutritious way?
Thank you. We need to go back to basics. God created very nice and healthy food. But of course, because we have to manufacture food and preserve it and keep it on the shelf for so long, we have had to process food and therefore lose the wholesomeness of the food sometimes. And therefore, instead of limiting the intake of carbohydrate completely, because that's what some of the things that people are doing. She said she did keto, so she eliminated carbohydrate from her diet, and yet carbohydrate is a very important nutrient for you to have. So what we need to do, let's go back to the whole food that we used to have. Those of us who are of our age, we really went to the supermarket to buy the flour, the maize flour, right? We used to go to the portion meal, especially those who maybe came from the village like me. I never saw a packet flour. I'm not demarketing anybody, but what I'm saying is that try as much as possible. Go to natural, wholesome food. Those are the food that are loaded with nutrients, and therefore you will get all that you need from those foods. And then instead of eliminating, there's something we call portion control. So I do not want to bring a lot of science here. I want to make it simple. If I'm having my carbohydrate, I need to ask myself, how even active am I? If I'm seated in the office the whole day on those seats that go around like this, you know them, and then I drive back home, I go and sit in front of my TV, I do not do any form of physical exercise, and then in the evening, I sit with a mountain of ugali on my plate, and very little vegetables, you know, very little vegetables, and then a plate of meat, maybe a huge portion. What is happening there is that I'm having too much of calories or energy that I don't require. So I think whole food and then checking on your portions. You don't overdo and then go for whole food. And then what she has said, exercise. Let's not complicate it. You can even choose to walk or jog or run in your compound or outside wherever you are, just to be physically active. Or go up the staircase. If you are working in a place where you have a staircase, just go up and down instead of using a lift. That is still some form of exercise. So let's make it simple and make sure that we are doing it every day. And then maybe the last one that we ignore most is sleep. If you want to be healthy, if you want to lose weight, you must have adequate sleep, a minimum of 7 hours. And I'm telling that also to myself. Be deliberate about your sleep. If you're missing out on your sleep, the doctors here will even tell you. Some of the health conditions we have are being brought up because of lack of sleep. So your body is not able to rest and repair. Thank you.
Thank you. Doc, Dr. Carol, back to you. So when it comes to, you've said obesity is a disease, and now I'm sure everybody will be worried about their weight. But how do we stop obsessing about weight and do it in a sustainable, a healthy way? I ensure that, yes, I'm taking care of my weight, but again, I'm not obsessive over if I add 1 kg, oh my God. Yeah.
So before, we used to use the BMI to define obesity, meaning that you're a certain height vis-a-vis weight, and so you have obesity. But that definition is changing. We're looking at your waist circumference, those of us who have a bit of fat around the waist, because then that has been shown to have a higher risk of other cardiovascular disease or heart diseases. And so before you actually rush for the quick fixes, as we've said, we need to first define what class of obesity are you or weight are you in. And so you need to have your waist taken, your height taken, your hip circumference taken. And so we are able to calculate your risk. With that risk, then we tell you that you urgently need to do something about it, and this urgently over and above the exercise and the nutrition, then we recommend other ways, either medication or device therapy. Or we tell you you're in the mid class of obesity, and so we are able to do it very gradually in terms of exercise and nutrition. And now we target, okay? We are not targeting 10 kgs in a month. The recommended is just 0.5 to 1 kg per week. So that means that if you lose 2 kgs in a month, sustainably, you're on the right track. If you lose 2 to 4 kgs, you're on the right track. And so we are able to calculate that for you according to your risk. Do you have other diseases? Do you have diabetes, hypertension, heart disease, kidney failure? And so all these, we are able to say how aggressive should you be to lose weight. But really, if you're able to prevent the weight from coming in from the first place in terms of eating right and exercising, that will be good. And also part of the service that we are offering out here is actually to check your body analysis now and to see, now we're not only looking at the muscle and the weight, it's how much fat do you have around the organs, what you call visceral fat, how much subcutaneous fat, how much water intake. And so it's a bit more comprehensive now, as opposed to now looking to just losing the 1 kg on the scale. And during this weight loss journey, we're looking at something called non-scale victories, meaning, yes, you may not have lost the kg, but are you sleeping better? Are you moving better? Are you feeling better? For the ladies, is your menstruation better now? So we're looking at other faculties, not only the weight and the scale. And so it's just now removing our mind from, let's lose the extra kg, but how sustainable is it and how healthy are we doing the weight loss?
Okay, thank you. So as we wrap up the session, John, maybe you can finish off by telling us the importance of rest in our mental health and maybe your final remarks, just in a minute, because time is up.
I would want to talk about self-care because everyone has been speaking about self-care, and I really agree with them. As women, we are taught to allow others to lean on us, and so we do not know how to rest. I remember my mother telling me at one point of my life that as a woman, you do not get tired, you're never hungry, and what is the other thing? You know, that kind of conversation you get it, so you are supposed to be ever full of strength. And we have embraced that as women. And one of the things that I'll say to us women is no one else will stay in your life like you stay for yourself. So you need to look inward and ask yourself, what do I need today? What is it that I need to provide myself? And do that for yourself. When you need rest, do not wait for your people around you to tell you rest. Please take that rest. Have yourself checked in case you need to have yourself checked. As you allow others to lean on you, be the first person who can lean on yourself.
Thank you. Lily, what advice would you give to somebody who's going through any form of mental trauma? So it could be psychological, physical, emotional.
Okay. First thing, you would begin by, this is a new life you have come to. So you need to identify yourself. And being that, at that situation I was mentally, physically, and spiritually affected and sick. So you need also to know that you have to accept yourself first, so that now you can begin to go to the next step. And now, beginning like that time when I used not to walk, I had to come into to talk to myself and God that now, Lily, you have to lift yourself from this place and walk, because nobody will come into your life to make you move out of that bed. You're the one mentally. Pains begin with it's begin in the mind, then yourself as a body. So when you really accept the situation you are into, now you know the solution to the next step.
Okay, Percy, final remarks.
One, two. Hey there, I know, I don't know what you could be facing right now, but this is my charge to you, that maintain a robust, healthy, vital, pulsating relationship with God, because if you are spiritually anchored, that's where you'll draw strength from, all right? No matter what you face in life, I've observed people that have a healthy spiritual life, they are always resilient in crisis, centered in identity, anchored in peace, and they live a purpose-driven life. That no matter what comes your way, if you can put God first, believe you me, you can face any crisis with boldness. God bless you.
Thank you. Dr. Gladys?
A healthy mouth is a healthy mind. What this means is, if you have a healthy mouth, then it means that we've been able to have a peek into the rest of your body. You will be at peace, you will smile more, you'll be more confident, and you'll be able to face life because any moment you are speaking, you're engaging, we can tell, we can see, and the first thing we see is your mouth. So if you're not having a healthy mouth, it means you're not moving around confidently, you're hiding, you're not participating in daily life activities, you're in distress, you're in discomfort. So visit your dentist today. If you'd like, we have a free dental checkup outside, courtesy of Real Smiles Dental Clinic, free of charge. Have a chat with your dental care practitioner.
Thank you. Dr. Mithi, final remarks.
Eat healthy, move more. Thank you.
Thank you. Emily?
Food is medicine. Please take it and take it very well. You'll keep diseases away if you use nutrition well.
Thank you for your time. God bless you. Yeah, I'll hand it over to Dr. Korir.
Thank you very much, MJ and the panel. Let's give them a warmer round of applause. So I know we have been talking, telling you many things. Now I want to give three of us an opportunity to tell us something before we move to maneno ya pesa. I want to take 3 questions, comments, feedback from anyone who wants to say anything or ask anything to any of our panelists. We'll give them the opportunity to answer. Unajua watu wakinyamaza inamaanisha either tulikuwa tunajiongelesha ama tuko pamoja. Ni gani? Any questions, comments? There's one on this side. Watu hapa katikati wenye wanatuona vizuri. Anyone with a comment or a question? We have 2 more on this side. Watu wa katikati wako. Oh, so there's a lady next to the camera. Please make it very brief.
Good evening. My name is Caroline, and this question is to the oncologist. We find that I work in a healthcare facility, and most of our patients are female, like women. So in my mind, I ask myself, is it something that we are getting as, like, is it linked to any hormonal, like, things we are getting, like the family planning? And yeah, that's my question.
So that's to Dr. Ndirito. Please keep the question. We'll answer all the questions. There was a hand up this side, at the back, near the 2 camera crew at the back. No, we'll take all the questions first. There are 2 persistent hands there.
Good evening.
Good evening to you.
Mine is a comment directed to Mrs. Madhu. Mrs. Madhu, thank you for how long you have been sharing and inspiring women, mostly. In the year 1997, my co-wife, not my co-wife, what we call a brother's wife. That
Your
brother
sister-in-law.
died. Yeah, I'm directing the Parents magazine. That brother had an accident and he died. He had a wife and 3 kids. So by the time he died, he was to be paid. She was to be paid through the insurance. But the in-laws, who are also my in-laws, knew that there was some pango or candle, but the wife with 3 kids never knew that. So the in-laws wanted to support the woman with 1 kid, and the wife with 3 kids, she was to eliminated. But through Parents magazine, if you can remember that case, that woman, I was shocked, and everyone was shocked how she managed to come to Parents and tell her story, and through that story, she got her referred back. Thank you, Mrs. Matthew.
That's powerful impact. Thanks, Mrs. Matthew, for telling these people stories. We can hear they have real life impact. There is a lady at the back.
Okay. Thank you for the knowledge. Mine is to ask, ages, you start experiencing some changes in your body. For example, a time came now when I'm climbing the stairs or somewhere like a hill, you feel some difficulties on your legs, and then I normally consult people asking them what is happening, and most of them tells me I need to take some supplements. So my question today is, what kind of supplements is one supposed to take? Because already I have some in the house. I was told I buy magnesium, calcium, what, and I bought. Okay. So I want to know how somebody is supposed to know what kind of supplements you are supposed to take as you age. Okay. Is it potassium? Is it calcium? Is it what? Okay. Yeah. Thank you.
So I think I'll split that. Thank you for the question. I'll split that question for the nutritionist and the women's doctor. Then the very, very last one is here, and then I'll ask Dr. Ndiritu, Dr. Mutahi, and Emily to come so that you can answer this question. So make it very brief.
Thank you very much. The last panel was particularly amazing. Mine is reflecting on the majority of us in this room. We are mothers and parents at the same time, and maybe reflecting on what Joanne mentioned about women being the pillar that everybody looks out to and shaping communities. How can women in this room transfer wellness to their daughters and sons and the rest of the family members? Thank you.
Very, very important one. Joanne also stepped to the stage. So we'll start with Ndiritu on the cancer question. And then the 2 ladies here will talk about aging and supplements and whether supplements are welcome. Then Joanne, how do we transfer the knowledge to our daughters and sons?
Yeah, I think that was a good question. And I think she was talking about why there are more cancers in women than in men. If you look at the 2 common cancers that we talked about, the question you're asking is about what are the risk factors that predispose you to these conditions. If you look at the breast cancer, you'll see there's a lot of hormonal causes to it. You'll find it is more common in women who got their periods for the first time when they are very young in life, and those who also tend to have their periods over a long time before they get to menopause. And what that talks about is the exposure to the female hormone, the ones we call the estrogen. So if they have had that prolonged exposure to estrogen in their body, then they are more predisposed. The other thing is ladies who get their first child later in their ages. The other thing is those who don't breastfeed at all. Also women who have never had children, they are at a higher risk. Then there are also those other lifestyle factors that we are talking about: obesity, alcohol, smoking, they all contribute to that. Then there are those that are hereditary, in that they run in families. And you find them also common, especially in breast cancer. If you look at cervical cancer, you find ladies who engage in sexual activity early in their, like in their teenage life, maybe in their 15, 16, when they engage in sex very early in life, that is a predisposing factor. Those who have multiple sexual partners. Remember we talked about the HPV. HPV, we said it is sexually transmitted. So you get exposed to the HPV early enough. Then having multiple sexual partners, or having a partner with multiple sexual partners. The other thing is your immunity. Your immunity plays a role in it. You'll find those who have low immunity, like those who have HIV/AIDS, you may find them getting that period we talked of cancer, between the time the changes in the cells happen to the time you get cancer. You find theirs may come earlier just because of their immunity. Then there are also those lifestyle factors that we have talked about. Still the same thing: smoking, alcohol, lack of exercise, and all those contribute. So with all the cancers, you'll find there are risk factors to them. There are those related to either their fertility, their childbirth, sexual activities, lifestyle diseases. So if you look at all that, it will tell you what is making them have more of that. But of course, if you look at generally the statistics in cancer, you'll find cancers are more common in women than men.
Thank you. Maybe I'll tackle the aging. At the beginning, somebody talked about menopause and whether we can pause it. Unfortunately, we can't pause it. So as you age, how God created us is that we were supposed to be fertile for a particular period of time, and then our bodies will go into rest, which is menopause. Okay? So as we rest, as our bodies go into rest, our ovaries, that is where our hormones are produced, the eggs are produced, under certain hormone called estrogen. Okay? So as you age, your estrogen drops. Okay? And that is now where you come and get your hot flashes, your mood swings. You wake up and you want to cry and you don't know why you're crying. Okay? So get prepared. You'll have low mood, low energy, and then it also affects calcium absorption. Okay? It affects your calcium absorption. So you'll start having back pains, knee pains, you're having trouble going up the stairs. So those are among the issues. However, we do not advocate for you buying your supplements over the counter to supplement your calcium, okay? Please get advice from your healthcare provider so that it could be just the calcium that has gone down. It could be menopause or it could be something bigger, you know. Like you said, the cancers are presenting as fatigue, loss of energy, back pain, knee pains. I can't go up a flight of stairs. So before you go over the counter, please seek medical care from a licensed medical healthcare provider, okay? While we are on it, remember we said you're not too young or too old for screening. Out here we are doing pap smears for free, so screen, okay? All right, thank you.
Okay, thank you. Still about aging, I'll take a different perspective on our diet. So aging is a process that we can't stop, but we can age gracefully. So if you're having healthy diet and healthy lifestyle is you're physically active, you're not smoking, you're not abusing drugs, if you're taking alcohol, but this is church, so I don't think there's anybody who's taking alcohol here. Your pastor is here. So, yeah, your pastor is here. So, if you're also over-consuming alcohol and doing all those things I'm talking about, then you'll age faster. Your organs will start not serving you well. And then the other thing is, with supplements, it is very important for them to be prescribed. We have toxicity of some of these supplements that we take. So you're having back pain and all that, you go to over the counter without seeing the doctor or the nutritionist, you go and take those supplements, you don't even follow the prescription, then now you come with a bigger problem. So I'll still insist, if you have a problem, you have knee pain, you have back pain, please visit your healthcare provider. Let you be advised properly. We will check you. If it is calcium that is too low, a calcium supplement may be prescribed, but for a period of time, and it's a prescription. So you'll have the right dosage. So that is the best way to look at it. Thank you.
For a very long time, emotional wellness has been ignored, and especially in Africa. And we are growing into the knowledge of emotional wellness because the other forms of wellness have been embraced a little earlier. So for you to pass wellness to your daughters or to your people, please invest in wellness yourself. You cannot give what you do not have. You can consider therapy as a form. You can invest in other forms of wellness so long as it is from a well-known resource or from a professional, because everyone speaks of being an emotional wellness person. So consider having a professional take you through that. Now, once you have learned, the highest form of learning that we embrace as society is social learning. What we see rewarded in our homes is what we embrace as the normal. So as a mother, if your children will see you resting, they'll see you sitting and having a meal, they will see you eating and not letting every other person eat, and then you're without food. Or when you go to take them out, you know the way we do practical things like we eat from the children's plate. We are teaching them a level of neglect. And this is what they grow to become. So if we teach to prioritize yourself, because when you prioritize yourself, you have well enough, you filled your own cup, you have something to pour to them. If they see us taking care of us, then they will learn to take care of themselves. The second thing, I can see Dr. Mercy is stopping me, is fine, let me finish. The second thing is, as you take your people through, talk to them about these things. Practically let them know how not taking care of yourself affects you. Because you know, I assume you'll be able to pass the information. So let them know. When you see them, stop them so that they can understand that is not caring for themselves, and this is how they can care for themselves better. Thank you.
Thank you. Thank you very much, Joanne. And the earlier panelists, you can take your seat. Let's give them a warm round of applause. I know we have deviated a little bit from the program. We'll have a brief entertainment, and then we'll do the last discussion on finances, medical insurance specifically. And as we wait for the entertainment, we are talking about wellness. So I want us to take a brief health break. Just stand. Let's all stand a bit. And just tell your neighbor the two things that you have picked, one from the earlier panel and one from the second panel. Even if it's the name of the panelist, it's still okay. And this is an opportunity also to know who your neighbor is. So I hope people have not sat with the people they know. Mithi and Hazel, I don't see you talking to each other this side. Just two things. Musiseme kila kitu. Only two things. Thank you. Now we can take our seat.
All right. Good evening, everybody. Let's stretch a bit. I know you guys have sat for too long, so let's just stretch a bit. All right. To your right and to your left. Both hands up and down. Lift your right hand up. All right, swing it to that side. Excellent. Switch it up. All right, take it down. Stretch. I know most of you are. All right, and out. Okay? In the spirit of wellness, as we do just a 2-minute mix, I want to invite you guys. We are having Dance to Educate. All right, so we normally dance to educate teen moms. All right, so this is the Dance to Educate team. So you can join us for a Zumba session on the 2nd of June, all right, at Valley Arcade, and also on the 8th of August. All right, so karibuni sana. That's our team leader, Lilian Nkonge. She's the one who educate. We normally dance for a good cause. So we're educating teen moms who are vulnerable, all right, all the way from Meru. So whatever we do, just like giving back. Are we ready? Are we sure? Ebu ask your neighbor, are you ready? Are you sure you are ready? Are they looking convinced? All right. Okay, let's do this. Some volume, please. I just move side to side. Let's go. And step. And step. Excellent. Now give me the both hands. Push it down. One more time. Walk with it.
Step on the enemy, step on the enemy. Oh,
walk with it.
Step on the enemy, step on the enemy.
Nice. Now give it a bite. Give it a bite. Give it a bite. One more time. One more time. Give it. Okay, now go out. Let's go. 3, 2, let's go. Pull it up. One more time.
Weka shida chini anaweza, si unajua anapendeza. Tunamsifu na different style, kwa makofi na kucheza. Weka shida chini anaweza, si unajua anapendeza. Wanasema gospel si ya wajanja, Wakristo na mashida wana majanga. Shetani tunamzika, hii ni matanga, na nguvu ni za Yesu si za waganga. Kunja mguu, enda chini mpaka chini, ni Yesu tu, ndiyo si tunaamini. Mikono juu, nakwambia weka juu, jina la Yesu litafika everywhere. Tunagwara gwara, gwara gwara, gwara gwara gwara. Tunadansi ya Yesu, gwara gwara, gwara gwara, gwara 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 gwara. Hakuna kama Yesu, gwara gwara, gwara gwara, gwara gwara gwara. Tunadansi ya Yesu, gwara gwara, gwara gwara, gwara 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 gwara. Hakuna kama Yesu, gwara gwara, gwara gwara, gwara gwara gwara. Take it up, take it up. Tunagwara gwara, gwara gwara, gwara 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 gwara. Tunagwara gwara, gwara gwara, take it up, gwara gwara gwara. Tunagwara gwara, gwara gwara, gwara 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 gwara. Take it up.
gospel in a tambaga. Goosebumps, goosebumps. Wadamo in a penyaga. Bambaga. Wayaga. Ola ni moto. Wayaga. Hini mkwa. Naruka ruka ruka kama chimpanzee. Kuku internalize guaranteed. Light or darkness, choose one. You have to right balance. Yaga wezi balance. No, you just remember. It doesn't mean it's still trendy. And you listen, master ni garama. How many para without trading? Checking it free without spending. Hapa ndo najua ujinga spending. Lion number, critics, I'm reading. By the name of Javed. Wayaga. Wayaga. Ola ni moto. Wayaga. Hini mkwa. What me coulda be without your love? What me coulda be me without your love? I'm just a ghetto boy, me sick it too without your love. What me coulda be without your love? One more time, me take it on nada.
Alemba, Shanku Master. Clap on the hands, clap on the hands. Everybody, let's go. Everybody go down. Go.
Thank you. Give them a warm round of applause. I hope we are now warmed up. Feeling a bit energetic. Tuendelee na muziki ama tuendelee na mazungumzo? Muziki ama mazungumzo? Hao wanasema muziki, hao wanasema mazungumzo, hao wanasema muziki. I hope you are feeling now energized and ready for our final discussion, and we are talking about money. So as we set up the stage, what is the one thing you want to hear from the money discussion? I know Dr. Nderitu said SHA is working. Is that one of the conversations you want to hear? Is it really working? Naona kuna doubting Thomases wengi hapa pastor. Hata wewe ni doubting Thomas. You have work to do. Thank you very much. So we'll get to our last conversation. Let me start by welcoming Dr. Sahondra Kiplagat. Let's give her a warm round of applause as she comes to the stage. Dr. Kiplagat is a lecturer. She's a PhD doctor and an MS warrior. How many of us know what MS is? Not Veronica. MS, multiple sclerosis. This one I allow you to quickly look at Dr. Google, tell you what multiple sclerosis is. We'll get to hear her story on that. Next is Dr. Catherine Nyongesa from Texas Cancer Center, one of the very first women to set up a facility to take care of cancers in Kenya at the time when many people are not venturing into treatment of cancer from a private perspective lens. Next, I'll welcome Dr. Mutuma Zambezi. Dr. was supposed to be on our first panel, but we have brought him to our last panel. He's a consultant pathologist. We'll get to hear about the cost of diagnosis and the cost of cancer. And we'll also welcome Dr. Jane Mnyapara, the head of clinical operations from Jubilee Insurance, Jubilee Health. Let's give a warm round of applause. And then last but not least is Hazel Koitaba. Hazel is the Director of Beneficiaries and Provider Management at SHA. So wale ambao mna maswali ya SHA, we have the right person for you. Parents, made sure that the right voice comes here when you want to ask your questions on SHA. So give me 1 minute. I have too many microphones. Thank you very much. Let's welcome the panel with another round of applause. Thank you. And we'll start with Dr. Kiplagat, then we come to the conversation on just how to take care of our health financially when especially faced with chronic illness. And so, Dr. Kiplagat, I'll start with you. You're a professional first, then you are an MS warrior. How was your journey, especially navigating the healthcare system, getting diagnoses and being able to pay for the care, because it's not easy, and you can tell the audience the details of what MS is so that I don't steal from your story.
Thank you very much. Thank you very much, Parents Magazine, for inviting me to be here to share my story. It's a disease. There are more patients today in Kenya, but when I was first diagnosed with multiple sclerosis in 2005, there were very, very few patients who had multiple sclerosis. So I was working at the University of Nairobi at this point. I already had a PhD, so I was working professionally. And that was one of the benefits, talking about the insurance, was that I'm covered by the university's insurance scheme. I was also covered privately with AAR at the time. And so having the two together helped a lot with the costs. It's a very expensive disease to deal with. In the beginning, with multiple sclerosis, they call it a snowflake disease because every single person who gets this disease manifests in a different way, like how snowflakes are all very different and unique. So when I first began falling ill, I went to the doctors at AAR, and then I was sent to a specialist to check if it was my knee, because my knee was collapsing. And then there was nothing wrong with my knee, luckily. And then I was sent to someone to look at my spine, and there was nothing wrong with my spine. My walking at this point got worse and worse. And I was then, my speech then became slurred. And so at this point, I was sent to a neurologist. And then this neurologist immediately admitted me to the hospital. And they began doing tests. And I have to say that they did everything right in Kenya. There were comments on stage of how we have everything that we need in Kenya for the testing. And even 20 years ago, they did everything right, even though this disease is quite rare. We had the specialists, and they did all the right tests for me at that point. They brought in specialists to evaluate me, and this was when because it's multiple sclerosis, one needs to have many cases of this happening. So according to my doctors here, this was the first time this was happening to me. I did not realize, again, because every time one is unwell with multiple sclerosis, something different happens. So I didn't realize that when I was unwell a year ago, before this happened, I was living in the US. And I didn't mention anything to these doctors in Kenya that this had happened to me. So this was multiple sclerosis happening again. So I've lost the ability to walk. I've lost the ability to see 4 times. It comes and goes. What happens to me, it comes and goes. When the nerves are attacked, it's an attack of the spinal cord and the brain. And as you know, the brain controls everything, our speech, our vision, our ability to think, to remember. So when these are attacked, the thing to do is I was advised immediately, I can't see, I must run immediately to my primary care physician, my ophthalmologist, and have her refer me to the neurologist and get admitted in hospital immediately. I'm very fortunate to still see very well, despite having my eyesight completely gone 4 times. I'm also very fortunate. I can't do stairs without a banister, but I can walk, and I used to walk for 3 miles. I think that's about 6-7 kilometers every day. Unfortunately, I need to listen to the advice of work-life balance, because with the workload of the university, I have of late begun to not be as active as I used to be. But I always love walking. And so that's my journey. And also I have to credit my family and God, my faith. I was brought up in a Christian home. My grandfather was a pastor. He was like a bishop in Madagascar. I'm Malagasy and Kenyan. My mother is a lay canon. She's here with me. Thank you for being with me, Mom. And so I've always been brought up in the Anglican faith, and to have faith in God. And I thank you, Pastor, for what you said about God. We keep God first. So, and our family also believed, and I'm grateful for my family, because life is never smooth. And the bumps that we have in life, what we always were told as children and how my parents live, they're not bad. It's just a bump. It's just different from what you used to have. And God is there with you, always. So when things change, so when I began having my knee collapsing, or in the US, when this happened, I was dropping things, and eventually couldn't really walk very well. But here in Kenya, as my body was becoming weaker and weaker, and I ended up going in a wheelchair to see the neurologist, who then admitted me. I never complained. I never cursed God. I never became negative. I continued with my life, and things were funny. And so I'm grateful that I'm still here today, 20 years after the diagnosis, walking, working, and praising God. Praising God most of all, because I give thanks to God and I give thanks to my family that I am here today.
Thank you, Dr. Kiplagat, for that powerful journey, 20 years on, and for inspiring. I'm sure you've inspired a few women here. So at the time, you said you had private and medical cover, but we'll come to the money conversation. Let me talk to Dr. Nyongesa just about the cost of care and how it impacts compliance to treatment advice, medication, and patient outcomes. I know you see patients who are chronically and terminally ill. So how does that key thing of affordability impact the outcomes of care?
Yeah, thank you so much. Yeah, let me take this opportunity to thank parents for giving me this platform, and thank the panelists and the moderator, my good friend, Dr. Korir. So cost of care is multifactorial, and I would say it is both direct costs, for example, looking for a doctor, paying the consultation, paying for the tests, paying for the treatment. It is a long journey. And then there are those indirect costs, which means, for example, you need time off work. And you can imagine most of us, it is a work pay. That is what we are on. If it is a side hustle, if you don't go to that shop, things will just crumble down. You also have the indirect cost of maybe taking care of the family. You abandon your children, you abandon your family because you are seeking health care. And then the other indirect cost is transport. You may be in the rural village and you are told you have multiple sclerosis, for example, or cancer. So you imagine the journey of traveling all the way to Nairobi to get this treatment because it's not available in the rural. And we find even many patients abandon. They actually don't show up because you don't have the transport. You know, yes, you have cancer or you have a disease, but you don't show up. So all these costs cumulatively add up, and they really disrupt families. And then there are other barriers, not just cost, but there are other barriers to care. physical barriers. We also know of economical barriers and knowledge. Knowledge, we are always told knowledge is power. So if you are aware, I think it is better you have the power to seek for help. If you don't know, you stay in darkness, and this disease progresses to a level where you spend more money. Because we know that mapema ndio best. Early diagnosis, timely treatment is much cheaper than when you wait for everything to escalate, and now it is a roller coaster. We have to manage the disease and the complications, and the cost of managing the disease and the complication is higher. But if you presented early, then we manage just the disease itself.
Thank you, Dr. for elaborating that, the indirect and the direct costs. So for Dr. Mutuma, in terms of diagnostics, sometimes we hear we have to send this sample to South Africa, to UK to get the diagnosis, and of course that doesn't come cheap. What are those cost barriers to getting the right diagnosis? Because the right diagnosis means the right treatment. And in a case like Dr. Kiplagat's, where every time it's a new symptom is something different, how do we manage that barrier to getting the right diagnostics?
All right, thank you very much for that. My name is Dr. Mutuma. I'm a pathologist, and as pathologists do the diagnosis. In most cases, especially when we talk about diagnosis in general, there are simple diagnoses, but I'll focus on diagnosis of cancer, because that's actually what I specialize in. And as we know that cancer is very common, and to get treated for cancer, you need a real diagnosis and a correct diagnosis for that cancer. And we saw for cancers, now for us as lay people, we know that we just know breast cancer. For us as pathologists, there are 15 types of breast cancers. When we talk about brain cancers, there are many types of brain cancers, and every brain cancer is treated differently. And that's why when it comes to diagnosis, for us, we just talk about cancer, but for us pathologists, we go to diagnosis, we have to go to details about diagnosis. And that's why most of the people, before they are treated, always the oncologist, that Dr. Catherine, will ask you for diagnosis. And she will go ahead and ask you which type of diagnosis. There are so many tests which are done. Like take, for example, cancer of the breast, because it's one of the most common cancers in Kenya in women. For cancer of the breast, before you are treated, you have to know which type cancer of the breast is it. Is it ductal carcinoma? Is it lobular carcinoma? Is it mucinous carcinoma? And there are many types of cancers of the breast. And then after that, you have to know which grade it is. They are grade 1, grade 2, grade 3. And those are very important when it comes to diagnosis, because you can have cancer of the breast. It is ductal carcinoma is grade 1. The treatment of ductal carcinoma grade 1 and grade 3 is very different. And that's why most of the times, as a pathologist, we have to go in details, know which type of cancer is and which grade it is. And then apart from that, we have to know, is it hormonal receptor positive or hormonal receptor negative? And that's why before, we used to take all these tests outside Kenya, because we are not doing hormonal receptors. By now, we are doing hormonal receptors now. And to start treatment of cancer of the breast, first, what type it is, and which grade it is, and is it hormonal receptive or hormonal positive or negative? And that's why it takes time from the time the patient is done diagnosis to the time the patient starts the treatment. It's not always 1 week or 2 weeks. Sometimes it takes more time than that. That's why I find that sometimes, or most of the times, the patients have to wait for some time before they start the treatment. And that's why even when the patient knows he has cancer of the breast, he has to take a bit of time before the treatment is started, because we have to know exactly what we are doing before start the treatment. Yes.
So you said this now you can do. Do you mean now you can do them here locally? And what is the cost like? Is it the same as when we are flying those samples out of the country?
Right. When we started, the cost was a bit high, because all the hormonal receptors for cancer of the breast, we used to take it outside. The cost was around between 40 and 50,000 that time. That's almost 10 to 20 years ago. But now the costs have come down, because all the hormonal receptor, they are done in Kenya. Is you really take them outside, and they are very cheap. It depends where you go, but most of the time, between 10 and 20, you can get all hormonal receptors of the breast be done.
Doctor, 10K is cheap.
Now, cancer of the breast to diagnose, there's no way you can get hormonal receptor done less than 10.
Okay.
You can't. Yeah.
Let me ask the money people if they can cover that 10K, because it's not cheap. Some people, for the whole month, they've worked and they've not even made that 10,000 shillings. So how can then insurance play a role in making sure that if I'm paid up for SHA or I have complementary insurance with Jubilee, for example, then at that point of diagnosis, the thought of the financial burden that comes with it is lifted off my shoulders because you're stepping in. And I'll start with Dr. Jane, Jubilee, and then I'll come to Hazel.
Thank you, Dr. Mercy, for that question, and thank you, Jcc Parents Magazine, for inviting us to be here. I'll tackle this question differently, and I'll start from the fact that medicine is changing. What was being practiced 20 years ago is not what we have now. So that again aligns to then the current changes in terms of diagnostics, treatment, etc. So for health insurance or people who are playing in that field then, it is upon us then to align what it is that we are selling to the public to be able to address this, because it wouldn't make sense if we are having a health insurance product that doesn't address the cost of hormone receptors, for example. So that's one way to look at it. And then the other bit also to look at it in terms of, so how can health insurance, for example, how can we develop solutions that speak to the market? We know, we are now in the era of Gen Z, a lot of things coming up. There's how people want to access service is different. People now want to access services from the comfort of their phone, right? People don't want to go queue in hospitals for hours. So then that brings in another aspect of how can we tailor solutions that, speak to what I do on a day-to-day. So then again, also looking at it in terms of, now specifically looking at the woman, and it has been said the woman is a cornerstone of the society. If a woman is unwell, then it means everything else crumbles. So then how do we as health insurance then come up with comprehensive solutions that look at all the health needs, so inpatient, outpatient, dental, optical, maternity, and all the comprehensive needs that need to be in that product, so that then the products actually talk to the population or to the community. And then again, I'll also talk about, there's that myth that insurance is expensive, all right? And when you talk about health insurance, most people say, it's for those people. But we're happy to tell you that it's no longer for those people. There are solutions existing that actually are low, right? You can get private health cover with Jubilee for as low as 6,200 for an inpatient. And not only that, again, we know most health insurance premiums are usually paid upfront, right? So again, for us to make it more accessible, we then need to think of how can we break down these payments so that then you're able to make these payments in installments and it can actually fit into your budget. So as private health insurance, in summarizing, we really need to come up with solutions that talk to the market, are addressing the needs, are bringing convenience to the people so that then the solutions actually tailor what is happening, both medically and the client's needs.
Okay, thank you for that. Hazel, on the same issue about at the point of diagnosis, what role is SHA playing in making sure that I, as a woman, if I'm diagnosed with breast cancer, for example, and Daktari here is saying for that test would be 10 to 20K, how does SHA play a role in making sure I don't have to suffer that financial burden because I'm registered and paid up?
Okay, thank you. Thank you, Dr. Korir, and good afternoon, everyone. I'd like to start by first explaining what is SHA, because I think from the 1st of October, the country started hearing about an insurance called SHA, which was replacing NHIF. So basically, the Social Health Authority is established through an act called the Social Health Insurance Act of 2023, and that is what established social health insurance, or rather Social Health Authority, to take over NHIF. NHIF, as you remember, was one fund. The one fund was basically dealing with chronic diseases. But what Social Health Authority now does is ensure that we're able to now pay for the investigative diagnosis to ensure that people are actually diagnosed early before whatever disease is coming up becomes chronic. So under Social Health Authority, we have 3 funds, one being the Primary Healthcare Fund. And under the Primary Healthcare Fund, that's where we now do the early investigation, like the cancers. You're able to get your checks, and there's a budget for that, especially for the ovarian cancer and so on. You also are able to go in for your regular checks to ensure that you're not developing sugar disease and so on. Then we've got the Social Health Insurance Fund, and that is what mirrors now the National Hospital Insurance Fund, which you were used to. But the bottom side of that is that that was only dealing with diseases once they became chronic. So with the Social Health Insurance Fund, you are able to now be referred from the Primary Healthcare Fund to be treated for any disease that is now advanced or becoming chronic. So under that cover, you are able to, we are able to manage your diseases through, again, the Social Health Authority. Finally, there's a third fund called the Emergency, Chronic and Critical Illness Fund. And with that fund, it means that anybody who needs that emergency care, if you're in an accident, if you fainted somewhere, then you can go to any hospital and be treated immediately, whether you're registered under the Social Health Authority or not. So as rightfully put, SHA actually comes in as a first payer in terms of before even Jubilee and other private insurances come in. SHA is a social health insurer, which means Mwananchi benefits fully. So basically, we'll pay for the diagnosis, we'll pay for any advanced care as a first payer before private insurance comes in. So basically, Dr. Korir, what SHA is doing now is ensuring that Mwananchi, whether you can afford or not, because again, you only need to be registered to be able to access primary health care without necessarily paying. And you can also access emergency care just being, actually you even don't have to be registered under emergency because as long as you're Kenyan, you can get that care. So Social Health Authority is actually there to ensure that all Kenyans have access to affordable quality health care.
So I'd asked people whether SHA is working, and everyone looked blank that it's not working. So from where you sit, you've explained very well, but is it working? Because the point of insurance is that at the point of care, I should not be told now, you need to top up or the funds are not there. At that point of accessing care, do I have to pay anything? Or is SHA living up to the promise of making sure that we as Kenyans do not incur out-of-pocket expenditure?
Not have to incur out-of-pocket expenditure. Unfortunately, for a long time in this country, Kenyans had to pay out-of-pocket whenever they had to access care. Dr. Korir, you know that we have the benefit package, which looks at the common diseases that are prone to this country. And the cost of care for those diseases is actually calculated after looking at what it, looking at what it would cost and what the hospital should take as a minimum, or rather as a maximum. So basically, if you go to a hospital, and I'll start with a public hospital, you shouldn't have to pay out of pocket. Why? Because when we say, for instance, we're paying for dialysis, which is about 10,400 per session, twice a week, that amount SHA reimburses actually is paid for fully. However, if you go to a private hospital, say a level 5, say Aga Khan and so on, now you're looking at what you're buying in terms of services, which means maybe the bed will be better than the public hospital, which means that you're probably getting better food than the public hospital, not to mean that there's anything wrong with that, but of course you'll now start to pay for the additional services, which means that dialysis, which would have paid for 10,400 comfortably at Kenyatta, will now become higher because of the other services around that. So what am I trying to say? I'm trying to say that SHA is working because if you go to a hospital where you can access services comprehensively, you will. But if you want to go and have those other enhanced care or services outside and above the cost of that treatment, then obviously you'll end up paying a bit more. But that should not say SHA is not working. I hope that explains that.
Okay, thanks for that clarification. Dr. Jane, how do you then collaborate with SHA and other public and private providers to ensure that people do not have to pay out of pocket, and even if they do, then you as a private insurer, if I'm signed up with you, then you're able to fully take care of whatever SHA has not been able to pay up?
Thank you, Dr. Mercy, for that question. So when you talk about us as a private health insurance, so you're putting basically two people in the healthcare system. That's the payers, that's SHA and the private health insurance. Then you're putting the providers. And then, of course, in the middle of all that is the client, right? Who we are jointly, and of course, there's a government being also one of the payers. So we are working together to then see how do we cushion the common mwananchi from making out of pocket payments. So for us to collaboratively and ensure that we achieve this objective, then it means I would look at it two ways. So one is we need to create a solution that addresses healthcare, that bridges a gap in terms of access. That's one, creating a solution, and then the other bit is whatever it is that is there, us as the parties that are involved in the healthcare system, ensuring that everybody is taking their bit and working as they should. Then if that is done holistically, then what that would mean it will be a functional healthcare system in that, so SHA would be the primary payer, they will take up what they need to pay, then the private health insurer comes in to complement what SHA has paid, the provider will be paid and they'll be able to give services to the client or to the patient, and then at the end of the day, then there won't be an out-of-pocket payment. So I'm looking at it having one system that functions. And then number two is, so when you talk of payments or paying hospitals, for example, there are many ways of how hospitals can be paid, right? So and we always joke where I work that, so we are an insurance company, we cannot exist without hospitals. So yes, I do have a solution, but if I don't have hospitals, then it means I can't do anything, right? So then we need to work with the hospitals to then see how do we create newer models of payment, for example, highest form of payment, capitation, etc. So we come up with newer models of payment that are value-based, right? That push healthcare, that push value-based care. And what do I mean by value-based care? Pushing care whereby for every shilling that Jubilee or that SHA is actually paying to hospital, that it's bringing the outcomes that it's intended to achieve. So I'm looking at it, working together in that ecosystem, creating solutions, making sure that the health system works, and everybody who is in that field, and then by us doing that, then we'll be able to reduce the out-of-pocket expenditure.
Thank you, Jean, for that. To Dr. Mutuma, having heard what I've said, they play a key role in making payments. Is there additional, say, investments or structural adjustments or policies that need to be put in place so that, say, for example, SHA is able to fully take care of the costs of diagnostics for chronic illnesses, including cancer?
Right. I think most of the times, I think for SHA now is making very good progress in terms of paying for the basic tests or basic diagnostics. But when it comes to serious disease like cancer, not yet, because I'm sure nowadays for biopsies and histology, for cytology mainly, for pap smears, which is very important for almost for every lady now, to be done pap smear and SHA pays. And also for other advanced tests like immunohistochemistry, we are not still there for the insurance to pay. Even for the private insurances, When it comes to the paying for some advanced tests, there's always a challenge. And what we are looking at as the doctors is when we can have each and every Kenyan being screened and the insurance pays. Because up to this time, if you want to be screened, if you want to be done mammogram, when you're not sick, and when you want to have to be done pap smear, we have to pay from our pocket. And that's where we need to focus on, so that we have population-based screening, mainly from the government, and also I know for the private insurances, like Jubilee, I think there are some people who have got policies where they pay for screening, mainly for the diabetes, for the hypertension, cancer of the cervix, that's pap smear, they pay, and also for men, they pay PSA. So we are not yet there in the government level, but I think some of the policies, private insurance, they normally share for that. When it comes to diagnosis, some of the diagnoses can be very expensive, and it can be a challenge when it comes to insurance paying for it.
Okay, thanks, Dr. Mutuma. Dr. Nyongesa, in your experience, what policy changes do you think are most urgently needed in order to reduce the burden of cancer care on women, both when they are patients themselves or when they are caregivers, either to their spouses or their parents or children? Are there any policy changes or any more support, say, from government that is needed?
Yes, thank you so much. So with devolution of health, I think with the county governments coming in, the government needs to put more resources in healthcare. Because as we've seen, women delay to seek healthcare because they do not have that power of you can't just wake up and go. You know, you have to seek for permission. That is how our society is. So if I seek permission and I'm saying I'm going to the county hospital for checkup, it is easier than if I seek permission to come to Nairobi from the rural. So it is strengthening those county hospitals. I know there's that facility improvement fund, and if we can build those mashinani hospitals, I think the screening that we are worrying about, the SHA will pay for it, and it will be more accessible, both financially and also physically to the masses. We know government hospitals treat the masses, which is very commendable, despite the limitation. So what I would have liked is also maybe we put more money in terms of the national hospitals, put more money in infrastructure, in human resource, so that we are able to take care of the bigger population. Because private, as much as they support, but we still need our national hospitals, because that is where most of the people go. And also, if you are in Nairobi here and your relative come to Nairobi, I'm sure you'll always say, can we try Kenyatta? So we need to make Kenyatta work. And I appreciate the efforts that have been there, but we still need to put in more and more, train more people. And also we move now back to education. We need to empower our girls, because education is very important. Case in point, I am a product of a teenage mother who dropped out of school because she couldn't go, she had to take care of children. She died early at age of 54, you know, and so because of that, my mom really faced a lot of challenges. So if you educate a girl, they will not go through these challenges of triple threat, gender-based violence, early HIV infection. You know, they'll also take care of their families because they are financially stable. It is one thing to be sick, but another thing as a woman to keep depending on your husband for money to go to hospital. You are borrowing transport, you are borrowing money for food, you ask for everything. That is a big threat for us to sustain. So we need to invest in education. We also need to invest in prevention as a government. We need to have a strong policy on prevention of cancer. I appreciate the HPV vaccine, though there are a lot of misinformation out there, but HPV vaccination, it is safe. It will save our women in future. I can tell you today, every day, 8 to 9 women are dying of cervical cancer. And the same maybe for breast cancer. But how do we reverse this for our younger generation by taking our children for HPV vaccine. And in future, we'll even roll it out to boys also. We are doing girls, but also boys need this vaccine. My son has had HPV vaccine. So it is a safe thing that we can give our young girls so they don't suffer. I see women coming to Nairobi with cervical cancer, breast cancer in late stages, and it's so sad. Just because we didn't have, or we didn't know those days that actually HPV could save these women. Self-breast examination, breast cancer awareness, it is important, it will save them because they delay. After diagnosis, they take almost 7 months before they come for treatment. So I am here to tell all the women that when you go to hospital, you have had a surgery, please go back for your results. I see women waiting more than a month, they don't go back, and they'll not call you back. So maybe in terms of policy, hospitals, public, private, they also need to have a mechanism of feedback. A patient came, they should call me back to go for my second, maybe mammogram. I've done 2-3 years, I need a mammogram. Or they saw some abnormality on my pap smear, I need to be called back. So digital health, which is one of our priorities of our current government, digital health will help. Because this physical, just phoning, may not be adequate because also of limited human resource. But if it is, I am able to be tracked. In developed countries, they can track you. When you are 40 years, you just get a message, please go for your mammogram. But here, nothing happens. You are a certain age, go for your colonoscopy. Go for your pap smear. So those are some of the policies we need to strengthen that in the future, they should be easily accessible. And also public education in terms of taking healthcare as a very personal responsibility. You'll be shocked, yes, we are crying SHA needs to pay for healthcare, but people are not taking it up. They don't register, they don't do the means testing, they only wait when they are sick, then they start doing. We appreciate that it's paying, like you register, you get approved immediately, like it's active, but we need to go back and encourage people to join so that this fund is more flexible now to support all those funds they've been talking about.
Okay.
Thank you.
Thanks, Daktari, for that. Thank you. Then finally, Dr. Kiplagat, after hearing the rest of the panelists and the issue of women empowerment, what support structures do you think need to be put in place to support women with chronic illnesses, women with terminal illnesses, not just mentally, physically, but also financially?
I think the financial side has been sort of answered very well by the SHA explanation. I would also like to say that the social side, I'm a psychologist, and the social side, it's one thing to have someone and your health is taken care of and paid for by the government. But who is going to take you to the hospital? We talked about traveling to Nairobi. Who is going to take you to the hospital? When I started falling sick, and I said to my mother, I'm so glad I was here in Kenya because my parents were helping me, but there was also the wider community. They were not the only ones who were helping me. And that's the blessing of being in Kenya, is it's not just your nuclear family, your husband, or he was taking you to hospital, your parents were taking you to hospital. My mother was taking me to the checkups. When I was going for the tests, I was going with a family member when my mother couldn't take me. When I was in hospital with MS, I have to be in hospital for a month or so. My mother would try to be with me as long as possible. She has other obligations as well in the house. And so she would rotate. She would be with me for part of the day. She'd go home and have her lunch. Someone else will come and be with me because there was a time when I was so weak that I couldn't even hold a spoon or a fork to feed myself. The nurses at the hospital are busy doing a lot of things. And so my mother would be there in the morning with my breakfast, helping me to eat my breakfast. I was propped up with cushions because I didn't have the strength to hold myself up. So I'd lean back, I had cushions on all the sides. Someone had to cut up all the food for me to eat it. And this is done by the family because the nurses are so busy in hospitals. If we don't have the support system of our families, and I think that's the blessing of being in Africa, is we have a strong support system of our families and our churches are also at work. The university was a huge support to me. But I think that it's something, we hope that this does not go away. It's something to value, to build, to encourage, that a lot of us, with our nuclear families, I feel that our modern ways compared to, I'm in my 50s now, compared to the world I grew up in the 70s in Nairobi and the 80s, where the nuclear family and the extended family and the church was very involved, I feel that we're very individualistic, even more so today. And I feel that it's very important that we don't lose that, because it does so much, and even just in terms of healing. As a psychologist, I know this. The social support and knowing that you have so many people around you, supporting you, praying for you, thinking about you, helping those around you who are thinking about you and helping you, it takes off the burden and the anxiety and the guilt that, oh no, my mother has not slept. She's been here all day, all night. So that's what I would say about that question. Thank you very much.
Thank you, Dr. Kiplagat. So that social support from the family, from the church is really important. I want to close this panel, but I'll allow just one very burning question, if at all. If everything has been answered, I'm also happy. Any burning question? Okay, none. So I'll give all of you just 1 minute or less for your closing remarks, and then we'll close the session there. I'll start with you, Hazel.
Okay, thank you. I think for me, it's just to encourage everyone to register onto Social Health Authority. You don't know when it will come handy. So go onto our USSD app of *147# and do your registration. If not, you can go onto the website www.sha.go.ke, register as a first step. Then once you do that, do your means testing and make your payment for your premium. Because even if you don't need healthcare today, there's somebody else who will need that healthcare. So Social Health Authority is about looking after each other. Let the healthy put in that money for the people who need the care. Let the young put in that money, and it's not much, to look after the elderly who may need that care. And let those who can afford, who have jobs, put in something small for that person without a job to access healthcare. Because the bottom line is for every Kenyan to access quality healthcare without having to incur that out-of-pocket expenditure. Thank you.
Thank you, Hazel. Let's give her a clap.
Thank you. For me, I think my last parting shot would be, we are one hospital bill away from poverty. So with the knowledge that we have obtained today, ensure that you have some form of health insurance, be it SHA, be it private, because when that medical bill comes, we don't know how much it could cost. It could be $1 million, 10 million, 20 million, or it can just be a 5,000 bob. So take up the initiative of seeking, getting insured, so that then that financial risk is taken away from you. As Jubilee Health Insurance, we have a lot of products for you, for your families, for individuals, for your SME, chamas, corporate. We have international covers. We have covers for as low as 6,200. So reach us, and we'll be happy to customize a solution for you. Thank you.
Thank you, Jane. Let's appreciate her. Dr. Mutuma.
Thank you very much. My parting shot will be two. First is that, one is that it's very important we focus on diet. For women, it's very important you encourage your family to take a food like medicine, or later you take medicine like food. Second, very important that you do screening for cancers. It's very important at your birthday. It's good to remember when you're having a birthday, it's good to remember to do your screening for cancer of the breast and cancer of the cervix. More important, the screening when you are having your personal birthday if your parents are alive, it's always important to remember to take them for screening, more so for men. Cancer of the prostate, very common men. If your dad is alive, if your grandparents is alive, it's important you take or you remember to take him for cancer of the prostate screening, because these cancers, all our patients, almost 83 of our patients here in Kenya, they come in stage 4. Cancer is treatable and curable at any stage. But when cancer is at stage 4, treatment is very complicated. Thank you.
Thank you, Dr. Mutuma. Let's appreciate him. Dr. Nyongesa.
Yes, thank you very much. So for me, I say, as women, we work so hard. Let's also learn to treat ourselves. As we take others to hospital, ask for the blood pressure test. How is my blood pressure? Check your blood sugar. If you have an infection, don't ignore. If you have anything unusual on your body, don't ignore. We need to know our bodies well. Let us be intentional in what we do. If it is having a family, have a family, a number of children you can take care of. Don't look at, oh, my sister, she'll take care, or my uncle, or my aunt. Please, be intentional in what you do. Plan your family, educate your children, because education will free your children from poverty, from all these diseases, because they'll have a good insurance, they'll have SHA, they'll have Jubilee on top, because they're educated, they have jobs, or they have businesses. And a healthy woman, to me, is a healthy nation. Thank you.
Thank you, Dr. Nyongesa. Then last but not least, Dr. Kiplagat.
Thank you very much. I think my parting shot is that what was very interesting is that multiple sclerosis is was very rare when I began having symptoms in Kenya. However, we did everything, the doctors that I saw did everything correct. When we were sent abroad to double check that this is what I have, they said they did everything right for you in Kenya. And I think that we disparage our medical system here in Kenya, but it is very, very good. And we need to acknowledge that our nurses are very well trained, our doctors are very well trained. We've heard today that they're experts in so many details of different diseases and can diagnose that. So I think that's my parting word, is just to say, let us appreciate what we have in Kenya and how good it is.
Thank you very much. Gentlemen and ladies, let's appreciate them with a warm round of applause. Thank you very much, and thank you everyone. You have been very attentive on this event. That marks the end of our panel conversations. I hope you have picked something from all the 3 panel conversations that we've had on prevention, vaccination, early detection, and I like what Dr. Mutuma said. Your birthday is a reminder to do a wellness check on yourself and those that are around you. So thank you very much. Thank you for being attentive, for being participatory. This event wouldn't have been here if it were not for all of you being part of this conversation and contributing immensely to the conversation. I've been your event moderator, Dr. Mercy Korir. This is a place I say subscribe to my YouTube channel on Willow Health Media, where we continue some of these conversations with some of these experts, so that, as we said, knowledge is power, and we want to make sure that you have that information, you have the right information, that you're not scared by Dr. Google, but you have the right information that helps you make the right decisions, not just for you as a woman, but also for the family, which is the unit of society. So I'll hand you over back to our Gen Z, our MC, Veronica. She can take it up from here. Thank you very much. Let's appreciate my panel.
Thank you, Dr. Mercy. We clearly cannot exhaust conversations when it comes to health and wellness for women. And so we will continue writing about it as Parents Africa magazine, who care for you and your family. Let's say that again, we care for you. Thank you. Kindly clap for our panelists as they step down. Thank you very much. Now, as I said, we will continue writing about these conversations. because we care for you and your family. And that is why our most recent issue, which is, as I said, it's a health and wellness issue, has stories of Dr. Sohundra, has stories of Lily Murugi. And so if you want more information, because as you can see, they could not exhaust the whole story, kindly visit our epaper.parentsafrica.com. I'll say it again, epaper.parentsafrica.com. And also, if you want to read more about Elizabeth Chiuma's story, her story is on the issue from 2023 March that has Joan Mwangi on the cover. Ensure you read it because it has a lot of information, okay? And because we're running against time, I would like to call Neema to come and award deserving mothers. I know you're wondering what that is, because you cannot end the month of mothers without awarding and recognizing ladies who have been doing a lot of good work in this community. And so I will now hand over the session to her. Kindly make it really, really quick. I can see some moms already here. Yes.
Hi, everyone. Good afternoon. I hope you've learned a lot today. I've personally learned that my teeth are an indicator of my health. That was surprising. Anyway, as we near the close of today's event, we take a moment to honor the true heroes among us, our moms. These incredible women were nominated not for their fame or recognition, but because their stories moved us. They've overcome challenges, lifted their families, and inspired their communities through quiet strength and unwavering love. Today we celebrate their courage, resilience, and the powerful impact they make every single day. Please join me in recognizing these amazing mothers, women whose stories deserve to be seen, heard, and celebrated. First up on my list is Moesha K. Moesha K, please come. Moesha K, an award-winning dancer, turned her success into shelter for over 300 children. With love, she mothers kids from tough backgrounds, proving that true motherhood is built on compassion, not just blood. Moesha, thank you. Next up is Phyllis Jamoza. Phyllis, widowed at 26, Phyllis raised her children alone with love, strength, and endless sacrifice. She's now a guiding light to her granddaughter and a quiet pillar in her community. Her compassion touches many beyond her home. She's not just a mother, but a true hero. Jane Njambi. Jane rose from a tough start to build a loving home, strong marriage, and thriving career. A devoted mom of 3, she uplifts others through her faith, parenting, and service, showing that motherhood can inspire far beyond the home. And finally, the Lady Bishop. Give her a round of applause. Her gift will be received by Pastor Carol. A gifted multi-hyphenate whose roles span leadership, co-founding, preaching, show hosting, writing, singing, and entrepreneurship. She shepherds souls towards a higher calling, grounded in faith, rooted in love. A powerful embodiment of strength and resilience, she has navigated grief with grace and risen above it all to carry on a lasting legacy. Thank you to our moms. So give a round of applause for our moms, for every mom here. You're appreciated, you are seen, and you are so loved, and we hope that from here you remember to take care of yourselves. As a daughter, when you take care of yourself, you take care of me. Thank you.
Oh, thank you. Now we are going to award our guest speaker because she has done a good job, right? Right? Yes, and the guest speaker and the next people I'm going to call to get the awards are going to be awarded by our able Mrs. Mathu, MD. So kindly take the stage as we. So the first person to get the gift is Dr. Grace Kanyi. Thank you very much for your powerful speech. And you know, we've been streaming this event live. There's someone who has said that she is such a powerful lady. They have confirmed that they ever did a CS for them. So thank you very much, Dr. Grace. As they continue to hug and feel happy about this whole event, I would like to call, yes, I would like to call Dr. Mercy Korir. Thank you. Thank you very much for being the event moderator, the main event moderator, and for the two panels that you have moderated. Thank you. The conversation flowed. Did it not? Oh, so beautiful. Wacha niangalie huku nisilie. And then our very able Gen Z, unakuja hapa mbio. MJ, Dr. MJ Wanjiru, Dr. Mercy Judy Wanjiru. Thank you very much for bringing young energy on this stage. These are the Gen Zs we want to see up here because I know they have potential. And if you're a Gen Z and you're seated right there, simama, si saizi. In your life, ensure you take a stand and follow your passion, okay? Yeah, so kindly take a photo. Move a bit forward, yes. Get ready to clap for them the way I showed you as they step down. Yeah, let's go. You remember the clap? Okay. 1, 2, 3. Mwah, thank you very much. And now I would like to award our panelists. This one is going to be a bit faster. So in this order, Dr. Geoffrey Zambezi Mutuma, kindly come. Dr. Joan Mutahi, kindly come. Dr. Anthony Ndiritu, kindly come. Miss Elizabeth Chiuba, kindly come. These ones are going to be awarded by Pastor Carol. Let's start with Dr. Zambezi Mutuma. There he is. And then Joan Mutahi. And then Dr. Anthony. And Miss Elizabeth. Now the next panelist, Dr. Joan Kirera, kindly come. Pastor Dennis Barasa. Emily Wahome. Caroline Mithi. Lily Murugi. And Dr. Gladys Maina. In that order, kindly. Yes. Pastor Dennis Barasa. Emily, Dr. Emily. No, Emily. Thank you. Dr. Carol. Dr. Gladys. No, sorry, Lily. Lily. Let's go with Lily. and then Dr. Gladys. Thank you. Now they will award Dr. Catherine Nyongesa, Dr. Sohundra Kiplagat, Dr. Jane Nyapara, and Ms. Hazel Huitaba. Clap for them as they come kindly. And as we're almost finalizing, I would request Jerry Rollins to take up the stage kindly. Jerry Rollins is going to award the resident pastor who has been in contact with us. He has really helped us a lot, but since he's not here, his beautiful wife is going to pick it for him. The next award is going to Pastor Moneki, Peter Moneki, but it's going to be taken by Pastor Florence Moneki. Thank you very much. It has been a beautiful event, and we cannot finish a women's event without addressing femicide. I know it's not a health issue, but it has been happening a lot. And I know most of you know usikimia. How many know usikimia? Thank you. They are on our booth. They are at our booth. So if you like more information, they would like you to sign a petition that will make femicide a law, because it should be a law, but it is not yet. Anyone who is convicted of having committed femicide, they should be put behind bars, but it needs to be in writing, okay? So they'd like you to go and sign a petition to make femicide a law. And as I come to the end of my session, I'd like to call Njambi Gaito to come and give you the vote of thanks. But as she comes, kindly all ladies stand up. I am going to utter a few words here. And once I utter them, I'd like to hear a yes, okay? So once the way you are standing, kindly close your eyes and imagine a mirror in front of you, and you are standing in front of that mirror. So the person in that mirror is you. And that person, we are going to clap for her when I count to 3, and once we start clapping for her, I start uttering these words, you say yes, okay? All right, can you see that person in the mirror? On the count of 1, 2, 3, start clapping for her, because that person is a queen, okay? Say yes, that person is a queen. Fix your crown, lady. You deserve it. You deserve it. Thank you very much. Njambi Gaito.
Praise God. Praise God again. Are you blessed to be here? Do you feel better? Are you nourished? Are you tired? Can we continue? Thank you so much for being here. Thank you for today. My name is Njambi Gaito, and I am the digital executive at Parents Magazine. It's such a blessing and an honor to serve this beautiful, beautiful magazine for all this time. Amen? So allow me to give the vote of thanks. Before anything else, we give all glory and thanks to God. Without his guidance, his strength, and his grace, none of this would have been possible, right? From the first planning meeting to this beautiful moment, he has walked with us every step of the way. Let's appreciate our God. Thank you. We also extend our deepest gratitude to JCC Church. Thank you so much for your generosity in partnering with us and offering this sacred space to host such an impactful conversation. Your support has been invaluable. Let's give them a hand. To our amazing event moderator and wellness panel moderator, Dr. Mercy Korir, thank you so much for anchoring the sessions with wisdom, clarity, and compassion. To our Gen Z, Thank you so much. Mercy Judy, Dr. Mercy Judy Wanjiru, your grace, your vibrance has brought energy and comfort to the room. We truly appreciate you. Let's give them a hand. To our keynote speaker, Dr. Grace Kanyi, thank you so much for pouring your heart and expertise into today's session. You've reminded us of the importance of health, women's health and the power of informed choices. So thank you so much. To our incredible panelists and speakers, your contribution have been nothing but short of inspiring. Each of you has shared from your heart and expertise, and because of you, all the women in this room have left here feeling more informed, empowered, and uplifted. Thank you so much. Let's give them a hand. A special thank you to our partners and sponsors who have made this possible. Without them, we wouldn't be here today. Cindy. So allow me to mention them. As I do, you'll just clap as we go, right? So Parents Africa, the Vision Bearers. We have Bidco Africa, Safaricom Foundation, Amref Flying Doctors, Jubilee Insurance, Texas Cancer Center, Royal Smiles, Karunguru Coffee, Ashley's, Simply Foods, Melvin's Tea, Evolve Wealth Healthcare, Path Kenya, Shikisha, Equity Afya Hospital, and Jetlag Food. Thank you so much for walking this journey with us. Let's give them a hand. And now to the Parents Event team, led by our able MD and the Vision Bearer of Parents Africa. Thank you so much. You, Jerry, and Anne, thank you so much for the sleepless. Believe me, there were sleepless nights. So thank you so much for the sleepless nights, the commitment, and the heart you poured into every detail of this event. You are the quiet force that made this come alive. Thank you so much. And finally, to all of you and everybody who made their time to be here today, we want to thank you so much that you took your time to come, to listen, and to engage with us. Thank you so much for your presence because it means everything, and you're the reason we did this. Please give yourself a hand of applause. And as I mentioned earlier, I'm the digital executive, so mniruhusu niuze sera. If you're here and you're online, I'd like you to go to our pages, any platform that you're on, Instagram, Facebook, Twitter, TikTok, YouTube. If you could do that right now as I conclude, I'd appreciate ndio nione mnatufollow huko. So please go there, follow us. You can take, up and tuko na a booth, we have a photo booth out here. You can take photos as you engage with the event organizers up and you can just take photos and then tag us. You use the hashtag #wellwoman because we believe we've left you as a well woman. Thank you so much for your time. We really appreciate. And as I conclude, because this is Mother's Day, I'd really not want to go home and lack food. So my mom is here with me today. If you just wave. So Mom, thank you so much for your support. I appreciate you and I appreciate all the mothers out here. Continue supporting us, continue holding us, because I believe I live here as a proud woman, proud that I am seen, proud that I am celebrated, proud that I am listened to. So thank you so much for what you've been doing and what you'll continue doing. Asanteni sana. Until next time, have a good day.
Wow, hey, that was information for the last how many hours? Few hours, amen? Thank you. Let's all be upstanding. We live empowered, amen? Amen. So you have some information that you can go home and share with your neighbor, yeah? You can share with them about how to stay healthy, how to eat healthy, you know?